Hey, I guess you're watching this video because the thumbnail suggested CST questions. Well, you're in the right place. But I want you to wait to the end of the video because I'll have some bonus information. But on this video, I'm going to give you 3 CST questions, and the goal is to give you a video each week with 3 questions. So these are 3 questions that I find each week that are important, and I'd like to hear from you what the answers are. I'm not going to tell you the answers. If you know, put the answers in the comments section. All right? But remember, stay tuned to the end because I'll have a bonus question. Ooh, stay tuned. All right, let's jump right into the first question. I'm going to give you 3 questions from the CST exam. I'm interested, and obviously I'm making this quick little video, hopefully it's about 5 minutes, to see what kind of questions, see your opinion, to get your opinion on the CST exam. And this is for surgical technology. If you don't know what the CST exam is, it's a Certified Surgical Technologist. And I think the trend is that's the gold standard, and anyone that's been through a program knows that. So the question I have is, what's your opinion about the CST exam? Is it a good review? Is there a lot of good resources out there? I think a lot of students are trying to find a good source of study guides per se. But there's other certifications like the NCCT test, and I believe there's some online certifications, but I think the NCCT and the CST are the 2 tests that are on top there. But the question I have for you before I give you my 3 questions, and we're about 1 minute and 57 seconds in, is what's your opinion? Do you like it? Do you find that it's all over the place? How about that AST Gold Bundle book you buy? Is that worth the money? If you don't know, the standard now for the CST exam, it used to be 102 to pass, and I believe that was a 68%. If you don't know, the CST exam is about 175 questions, and they take out 25. So it's based on 150 questions. You needed 102 to pass, which is a 68%. They now lowered it to a 98%, or 98 points, I'm sorry. You need a 98 to pass, and I think that comes to 65%, if my math is correct. What is your opinion about, is that lowering the standard? What does that mean for healthcare? Is that a good thing? I've seen the MBS TSA send out emails, and you can go back and kind of read that. And maybe I'll put that in that link down below, and you guys can read that email. What's your opinion about that? Curious opinions out there. Just curious what your opinion is. Hey, add some comments, ask some questions about CST exams. I'm trying to make this. I'm going to add 3 questions maybe once a week, and something called surgical mapping. I'm just going to give you 3 questions, and maybe you guys can give me the answers to them. Anyways, first question. The primary purpose of a chest tube is to A, irrigate the pleural space, eliminate chest leaks, prevent pulmonary edema, or to reestablish the negative pressure. That's question 1. Question 2 on the CST exam. During an open repair of an inguinal hernia or an indirect hernia, which of the following drains should a surgical technologist have available to pass the surgeon once the spermatic cord has been dissected? I'll read it again. During an open repair of an indirect hernia, which of the following drains should a surgical technologist have available to pass the surgeon once the spermatic cord has been dissected? Is it A, the Melcott? Is it B, a T-tube? Is it C, a Jackson Pratt? Or D, a Penrose drain? Leave your answers in that comments. I'm pretty sure you know what that is. We're going on to question number 3 on the CST exam. So just to recap, I'm going to give you probably weekly 3 CST questions. And obviously I want you guys to just answer the questions in the comments if you want, if you can. It doesn't have to be students, it could be anyone. You don't even have to be in healthcare. Give it a try and see if you know. But I'm trying to expose people to more CST types of questions and also get your opinion about the CST exam, and maybe try to get a Q&A in the comments about how do you study? What's your study guides? Do you have groups? What books do you use? Did I read the 3rd question? No, I did not. Or did I? No, I didn't. It's right here. The 3rd question for the CST exam. Once the spinous process is exposed during a laminectomy, the next instrument needed for removal of the lamina is A. Kerrison rongeur, B. Pituitary rongeur, C. Pinfield dissector, or D. A periostal elevator. Leave your answers in the comments. And I will put the answers in the comments if I see a couple of them in there. But let me see what you guys have. All right, the bonus question since you stuck around. The bonus question since you stuck around to the end. Well, congratulations. You're probably about 35% of the people that watched. Congratulations. But anyways, the bonus question as I put my glasses on. Which of the following staplers should be used in an end-to-end intestinal resection? End-to-end. Think about that. Is it an EEA, skin stapler, an LDS stapler, or a purse string stapler? So, which of the following staplers should be used in an end-to-end intestinal resection? All right, give me that bonus answer in the comments also. All right, thanks for watching. Don't forget to subscribe. There's my face right there, and watch that video over there because it is good. All right, thanks for watching. Hey, we're back. We're back again. Here we go. Let the party begin. Just joking. Hey, extension from the last video. Each week, 3 CST exams. I'm going to put it up on the screen because I think people have been asking for that. Makes more sense, right? You see the question. I'm going to read you 3 questions. You answer it and you put it in the comment section. Okay? Now, it's something called surgical map, and I want you to look at that question, break it down. Do you know everything there is about that question, terminology-wise? Each answer, each option, right? Just don't know the answer and try to memorize it. Do you understand why it is? So anyways, we're going to jump right into that first question. Put it up on the screen. Bacteria can be reduced in the operating room by A. Aeration overnight, B. Damp dusting of surfaces each morning, C. Reducing air exchange in the room, or D. Maintaining humidity levels above 70%. So look at that question. Look at the answers. You probably know it. Go ahead and put it in the comment section. And we're going to move on to question 2. Question 2 is, which of the following items is used for sponging around the spinal cord? Right? Is it A. Cottonoids, B. Gauze sponges? Is it C. Peanut dissectors, or D. Laparotomy sponges? Right? Look at that question, break it down. Do you know what the specialty is? Do you know the difference between a peanut or a cottonoid? Right? Eliminate some options. Go ahead and put it in the comment sections if you know, right? I'll leave it up on the screen. 1, 2, 3, it's gone. On to the next question. We're gonna make these videos as short as possible, right? Each week, 3 questions. Stay to the end and I'll give you a bonus one. Let's see if you can stay. Anyways, 3rd question. When a herniated is strangulated, and sound good. When a herniated is strangulated, which of the following instrument sets is added to a general abdominal setup? Is it A, rectal? Is it B, vascular? Is it C, common duct? Or is it D, gastrointestinal? All right, look at that question. Surgically map it. Do you understand what a hernia is? Do you know what a strangulated hernia is, right? go ahead and put your answers in that comments, right? Hey, you stuck around for that bonus question. Now, we will have it each week, 3 CST questions. Quickly go through these, right? Keep these videos short. So if you're interested in certain type of questions, go ahead and put it in the comment sections about what type of specialty you're looking for, what type of questions, right? For example, sterile processing, is it more anatomy questions? So go ahead and let me know, right? All right, you stuck around. You're probably about 2% of the people. Now, hopefully you guys stuck around for that bonus question. Bonus question is, and I'll put it up on the screen, which of the following catheters is most commonly used to perform an embolectomy? Is it A, Robinson catheter? Is it B, a Fogarty, or is it Fogarty? A C, Melcott, or D, angiocath? Right, look at that question, surgically map it. Do you know what an embolectomy is? Right, it's important, start there. All right, put your answers in that comment section, and I'll see you guys next week. Get 3 more questions next week. And if you're interested, there's a video right there about sterile processing. Pretty cool video. It breaks it down for CST exams. And don't forget to subscribe with my little face there, okay? Otherwise, I'll see you next week. All right, it's that time again. 3 CST questions. Put your answers in the comment section. Share this video so it gets out there. The algorithm, like it. These are CST questions. Look at the question, I'll put it up on the screen, give me the answers, break it down. Maybe in the comment section, why do you think it's that answer? All right, first question is, which of the following retractors is used during a femoral bypass, or a FemFem? Is it A, Army-Navy, B, skin hook? Is it C, Harrington retractor, or D, a Belfour retractor? Give me some understanding why you chose that. That's the first question. Get it off the screen. Next question. Question number 2. Make sure you put the answers in the comment section. Question number 2. Traction sutures are used on common duct exploration to do what? Is it A, ligate the duct? Is it B, permanently close the duct? Is it C, hold that duct open? Or D, seal the stones inside? Now this is for an open gallbladder. Give me that answer. Hey, can you give me the 2 things that are ligated in a cholecystectomy or a gallbladder surgery? Put those answers in the comments. On to the next one. Don't forget to stick around to the end because there will be a bonus question as normal. Question number 3. When evaluating the patient, skin for a preoperative prep, which of the following is considered a contaminated area? Is it A, the groin? Is it B, toes? Is it C, body hair? Or D, the draining sinus? So think about which one is the most disgusting. Which one is dirtiest? Put your answers in the comments section. You stuck around for the last one, the bonus question of the day. Bonus one is an easy one. If you get this one wrong, well, it's okay. We still like you. The safest method for placing a blade on a knife handle is with A, mixer. A mixer. Is it B, your gloved hands, your hands? C, a needle holder? Or D, tissue forceps? Now I want the correct way by the book. All right, put your answers in that comment section. Hey, please like, subscribe. We're not done yet, so don't flip off. Yeah, we're done. Just look at this video over here. That's for other questions, and don't forget to subscribe. All right, that's 3 CST questions. See you next time. We are back with 3 CST questions. I've been absent for a while. I apologize. But yes, I have a job. And I cannot do these videos all the time. I apologize. But on to the first CST question. Again, my name is Brad. We're going to do 3 CST questions, give you the answers, I want you guys to look at these questions individually. We'll put them up on the screen. You break it down. If you have any questions, and if you know the answers, I want you to put your answers in the comment section. Okay? Share this video. Like, subscribe. This helps us get that video out there, helps us with that algorithm, okay? All right, on to the first question. First question, a little bit of an anatomy question. First question is, the small intestines begins at the blank. Is it A, the stomach? Is it B, the hepatic artery? Is it C, the pylorus? Or is it D, the ileocecal valve? That is question number 1. Put your answers in that comment section. All right, we're going to move on to the second question. The brain. Second question. The brain contains how many ventricles? Again, the brain contains how many ventricles? Is it 2, 3, 4, or 5? All right, put your answers in those comment section. If you can answer that further, how many ventricles we have, what produces CSF, and where is that located in what ventricle? Anyways, that was question number 2. How many ventricles does the brain consist of? 2, 3, 4, or 5. Put your answers in that comment section. And if you stick to the end, we'll try to give you a bonus question. Hopefully you guys can stick around, answer these questions, and provide some answers in that comment section, okay? Answer or question number 3 we're going to find. All right, question number 3 is craniocytosis, which is a condition, is a what? What type of condition is that? Is it A, premature closure of the craniosutures? Is it B, an infection of the subdural space? Or is it C, improper absorption of CSF? Or D, congenital collection of abnormal vessels? All right, go ahead and answer that in the comment section. Question number 3, craniocytosis. Do you know what that is? I'd like to get your feedback. What do you want to see in a surgical technology type of YouTube page, right? Do you want to see more of anatomy? Do you want to see more of maybe drape-in? We try to provide you, with the time I have allowed, any type of subject. So I'd like your opinion. What would you like to see on this YouTube page? And if you subscribe and share these videos, they help us out too, all right? Bonus question. All right, your bonus question is just an anatomy question. And anyone that starts any kind of CST or any type of surgical technology program should know anatomy. And this is a very basic, the abdominal or general type of anatomy, right? The questions you're going to have are the colon begins at where? The cecum, the jejunum, the ileum, or the sigmoid? Where does the colon, which is the large bowel, begin? Do you know what that term is? And the small bowel is obviously running into that part of the large bowel, and that's going to be the beginning of that large bowel, otherwise known as the colon. And it's also called something. What lies right below that small bowel? Put your answers in the comment section. Hopefully you enjoyed the 3 CST questions. If you want to watch other videos on CST questions, we have it right here. If you want to subscribe, hit that little icon with my face on it and subscribe to these videos. Share, like, and let me know what you want to see in the future, because we're trying to provide resources for everyone, just not the students, but anyone that's watching out there in the world. Be safe, and hopefully I'll see you next time, guys, okay? Bye. Hey, we're back. 3 CST types of questions. I welcome you. I'm Brad. I'm an instructor here at Southern Technical College. I'm going to provide you with 3 CST types of questions. These will be 3 exam questions. Show you the question up on the screen. You give me the answers in the comment section. Stick around to the end, and you'll get a little bonus question, so kind of incentive to stay through the process. Or you're probably going to skip right to the end. Anyways, not to solicit, but hey, once you subscribe, like, share, it helps me out trying to get this this page that we're doing here. Believe it or not, we're at 927 subscribers. So I thank you for joining. Share, we're trying to get to 1,000. and then I can retire. Yeah, right. Anyways, first CST types of questions, right? Sterilization, right? Put it up on the screen. First one, Bowie-Dick test. Do you know what that is, right? The options that they have available. The Bowie-Dick test is it A, concentration test? Is it B, a biological test? Is it C, a sterilization test? Or is it D, a vacuum test? What is a Bowie-Dick test? Hey, kind of a caveat to that is, how many times a day do we do that? Kind of look into that. That's sometimes CST will ask that types of questions. On to the second question as I look for it. On to the second question. Second sterilization question is, which of the following methods of sterilization is most widely used? Effective, the safest method of sterilization. Believe it or not, the most economical too. Is it A, steam sterilization? B, chemical sterilization? Is it C, the ethane oxide sterilization? Or is it D, glutaraldehyde? Put your answers in that comment section, okay? Which one, which type of sterilization is mostly widely used and most economical? That is question number 2. Moving on to question number 3. Put it up on the screen. Which of the following equipment uses high-intensity sound waves to assist in cleaning of instruments through a process called cavitation? Is it A, ionized radiation? Is it B, washer sterilizer? Is it C, washer decontaminator? Or is it D, ultrasonic cleaner? All right, put your answers in that comment section. All right, you stuck around for the bonus question. Listen, I don't want to solicit, but we really, we're getting to about 1,000 subscribers, and I thank you for guys to, maybe there's some people that actually do watch these videos, some probably do not. Hopefully the students can jump right on, suggest what they want to see, but I thank you for subscribing. We are about 927 subscribers. We're almost to 1,000, but love to push over that, right? That's the kind of a goal of mine this year, to get to 1,000 subs. Hopefully we can do that. Anyways, it's because of you guys, at least the people, about 4 of you out there that are watching, right? The bonus question, let's get to that right now. Stop talking, Brad. People got things to do. We don't want to hear you talking. The bonus question, it's a high-level disinfectant. Put the question up on the board. Glutaraldehyde is a high-level disinfectant that requires a minimal exposure time of, is it A, 45 minutes? Is it B, 20 minutes? Is it is it C, 2 minutes? Or is it D, 5 minutes? All right, put your answers in that comment section. Good luck. Hey, we're back with 3 CST questions. So answer a question out there that some people are asking about. Yes, I will put the answers in the comments of the other questions, but I was given some time for some other people to answer some questions. Just also another caveat to CST is some of the feedback that I'm getting. Why am I holding this? Some of the feedback that I'm getting from the CST, at least people that are taking the CST exam, is a lot of these questions that are coming back are more scenario based. And a lot of the review is not that way. So today's questions, I'm going to put them in a scenario, and hopefully you guys can answer in that scenario. You like that scenario? But anyways, 3 CST questions today, and these are based around scenarios. So get used to kind of studying that way. It's not going to be a straightforward question. A lot of these will be put in scenarios. But that being said, you should know the subjects, and that's all that really matters. But I would also, when you start looking at these questions, try to find keywords. These tests are not too complicated. I'm sorry. These tests are not trying to fool you. So look for those keywords in a sense of how they match up to the answers. So anyway, so let's look at that first one, and I'll put it up on the screen, and you put the answers in the comment section, okay? And if you stick around to the end, I'll give you an additional question just for your incentive to stay around, right? So here I go. First question, right? And I'll put it up on that screen so you guys can see it, right? During a surgical procedure, a patient sustained extensive burns on their arm due to a prolonged exposure to a chemical agent. Upon assessment, the skin appears white and charred, extended through the entire thickness of the skin, potentially deeper tissues. The patient reports numbness in the affected area. The patient reports numbness in the affected area. Question is, what type of burn involves damage to the epidermis, the dermis, and potentially deeper tissues is most likely indicated by these symptoms? Is it A, first degree burn? Is it B, second degree burn? Is it C, third degree? Or is it D, a fourth degree burn? So that is an example of a long scenario question. So it's in your interest to slow down and read these questions, right? You can find some key words there: the epidermis, the dermis, potentially deeper tissue. And if you know your first, second, and third, and fourth degree, it's progressively as it goes through the skin, right? So I'm not going to tell you the answer. Go ahead and try. Answer that. On to the next one. All right, question number 2 that I like, and I'll put that on the screen. This time I will. I'll put that on the screen right now. Here we go. Question number 2, scenario. A patient undergoes surgery to repair a traumatic injury. In the post-operative period, the surgical technologist observes redness, warmth, swelling at the surgery site. Swelling at the surgical site. Additionally, the patient reports tenderness, discomfort in that area. Which phase of wound healing is most likely occurring based on the observation? Is it A, hemostasis? Is it B, inflammation? Is it C, proliferation? Or is it D, remodeling? So as you read these scenario questions, slow down, try to find some key words. To me, it's observed redness, warmth, swelling. Which phase of wound healing does that fall under? Go ahead and give it a try. On to the third question. Hey guys, don't forget to like and subscribe for future content. On to the third question. That was my subtle way of trying to get subscribers. Anyways, I thank you for watching. Third question as I try to find. And why am I putting this up like a light bulb? All right, question number 3 as I put that up on the screen. And don't forget to stick around. I have one more bonus question. Here we go. During a surgical procedure, a surgical technologist is assisting the surgical team. The surgeon requests the administration of an anticoagulant to prevent blood clotting during the procedure. The circulating nurse prepares to administer the medication. Which of the following medications are example of anticoagulation commonly used in surgery? Is it A, morphine? Is it B, ibuprofen? Is it B, ibuprofen? Is it C, heparin? Or is it D, amoxicillin? All right, go give it a try. That should be pretty easy. But you can see how they start to put it in some scenario. The answer is probably obvious. Is it obvious to you? On to the bonus question. You stuck around to the last one. I appreciate it. Hey, don't forget to subscribe and like. And hey, suggest some things you guys want to see, okay? In the future, I'm going to try to get a little bit more in depth in these questions and try to break them down. But I just wanted to get some videos out there of a couple questions, stimulate CST. If you are a surgical tech in the field, or if you're a future surgical tech, give me your advice. Give me your suggestions. What kind of questions are you looking at? What's driving you nuts? What are you having difficult with? All right, bonus question. You stuck around. Here we go. Put it up on the screen. I'll read it for you. During a surgical procedure, the patient begins to experience excessive salivation or bronchial secretions, which interfere with the surgical field. As a CST, you remember the appropriate pharmacology intervention to manage this situation. What medication would you anticipate being administered to reduce excessive secretions? Is it A, the epinephrine? Is it B, lidocaine? Is it C, atropine? Or is it atropine? Or is it D, morphine? All right, give it a try. All right. Hey, I appreciate you guys watching. Let me know what you guys want to see. What are you having trouble with? In the future, I'll try to break down these questions in more detail. I wanted you just to be exposed to questions. My advice is try to expose yourself to as much information as possible. But what are you doing to study, right? It's a lot of questions. It's a broad spectrum of information, right? If you put in the work, and that is the key, put in that work, right? Anyways, thank you for sticking around.
It's ETO. You know what that is yet? Ethane oxide, right? That's a gas that's mixed with steam for sterilization purposes. So if you see the abbreviation ETO, that means ethane oxide. I want you to realize it's expensive. So when you see ETO, think expensive process. That's why a lot of facilities don't do that today. I don't see them out there very much. ETO, right? Also, when you think of ethane oxide, which is a gas process, I want you to think 8 hours aeration. So if there's gas, it has to be completely dry. The whole process of aeration, in order to get the gas in the process through, just think 8 hours. That's a CST question. They'll ask you, what is the aeration? How long does it take? 8 hours is the correct answer. Okay, we're on ETO, expensive, 8 hours aeration, right? So we know what a biological indicator. If you do not know what a biological indicator, I'll give you some examples of questions on CST exam. What's the most reliable way to prove that something's been sterilized? Right? There's many different ways, but the most reliable way is to use a type of bacteria in the sterilization process, and if it's killed, more likely it's been processed, right? So biological indicators use a live or type of bacteria, and that type of bacteria is Bacillus subtilis. So when you hear the Bacillus sub, I like to say, or the Bacillus subtilis, think of the ethane oxide. That's the type of bacteria they use to prove it's been sterilized in an ethane oxide or ETO gas type of sterilization. There's two bacteria I want you to remember. Bacillus subtilis is for ETO, and we'll get to the other ones in a couple minutes. Put this down. Moving right along, I want you to think economic, right? 8 hours aeration. Bacillus subtilis is the biological indicator. Low temperatures, right? 85 degrees. So if you see questions on the CST exam with low temperatures, 85 come to mind, more likely they're referring to an ethane oxide process, right? So if you have this process of elimination, yeah, more likely that's going to be the right answer. ETO or ethane oxide gas process or sterilization is the right answer. It needs to be completely dry, right? Instruments must be dry. So they ask you on a CST question, what process or what sterilization process needs to be completely dry? Yeah, ETO is your right answer. Now you ask yourself why that is. I want you to do some research on ethane oxide. Is it toxic to the patient? If we don't dry all that process off the instruments, is this gas or ethane oxide toxic to humans? Yes, it is. So when you do some research on that, you'll see that we need to make sure it's completely dry, that there's no particles left on these instruments. So when you use it for your own health, because they're carcinogenic, or the patient's safety too. So what process that has to be completely dry? It has to be ETO is the correct answer on that. It's used for sensitive items, right? Scopes, right? Lenses, things that can't go in steam. And there's other processes for those also, but for right now, ethane oxide was used for more sensitive items like scopes, right? All right, so there's an expensive version of sterilization. And I probably have tons of questions on that, but we're going to jump right over to steam, right? Steam process of sterilization. Yeah, it's more economical. So when you hear steam, what is a more economical type of sterilization? Steam should come to mind. It's very hot, right? So steam, we got low temperatures. No, steam is the opposite. It works on a higher temperature, right? H2O, no brainer, right? Steam, there's water involved, right? Very economical. Now, there's some temperature parameters I want you to remember. That a gravity displacement system, when you hear gravity, it equals cycles. You see on a question it says gravity equals cycles. And 250 is typically where a gravity steam sterilizer is going to be at. 250, right? It can range from 250 to 270, but you hear gravity on the CST exam, it's more likely the 250 parameter, right? Temperature-wise. Now, what is a flash sterilization, which uses a steam but flash? You know, in surgery, sometimes we need items that are emergency, not an implant, right? You cannot flash an implant, but items that you need because the case can continue unless you have this item, right? The patient's in jeopardy. We steam it off at a high temperature quick for lower temperature times. And I'll go over that a little bit, but that's what a flash is, right? So your research is what is an IUSS? You probably know it already, but I want you to do some research on what an IUSS is, right? It's not the SS Minnow. 250 is kind of the 250, 270 range is where steamless a flash sterilizer can be. But when you think of gravity, 250, when you think flash, you know, you're doing it quickly, 250. Something called a pre-vacuum system. They use that, it can be ranged from that 250 to 270 range. But if it says pre-vacuum on a CST exam, it's going to be 270 all the time. If it's a flash sterilizer or gravity, could range in that 250 range. But I'll go over some parameters of the times on that. Steam sterilization. So flash sterilization, 250, right? I think I confused a little bit here on this. So pre-vacuum, 270. What is a Bowie-Dick test? You ever hear about that? The questions on CST exam will be, how often do you do a Bowie-Dick test? So I'll tell you what a Bowie-Dick test is. A test for PSI or pressure or leakage within an autoclave. Now these autoclaves are big ovens that you process in steam or ETO, the sterilization process. But the reason we need pressure or humidity, a certain humidity level, or a PSI, which is a pounds per square inch. In this case, you need like a 27 PSI. The Bowie-Dick test is done once a day. We'll test to make sure there's no leakage in that we are getting that parameters of that nominal 27 PSI, right? So Bowie-Dick test with a pre-vacuum 270. Bowie-Dick test is done once a day to test for leakages, right? Leakages. So anyways, there's a biological indicator. And I told you a little bit about the Bacillus subtilis. The Bacillus sternothermophilus is another type of bacteria used for a biological indicator. So we have two bacteria that we use to prove the viability or the sterilization process within that biological indicator. And I'm not going to go into detail on how that works. You guys can do your own research on that. But for test purposes, if they say what type of bacteria would they use for a steam sterilization, Bacillus sterno, keep it simple and stupid, or the Bacillus thermophilus is what they use. They also call it genothermo, or I'm sorry, geobacillus, right? But I like to just say Bacillus sterno for the steam sterilization or the geobacillus, right? Biological indicator. Don't confuse that with a chemical indicator, which are tape or little things within trays to verify that it's been processed. It's, believe it or not, it's not the most reliable way as a chemical. It's a biological. Chemical is just verified it's been through a process. The most reliable way to prove something that's sterilized is a biological indicator, right? Now this is important for the flash. We know what a flash sterilizer is, right? Something you need right away. Now, we have things that are unwrapped. Things that are wrapped, maybe in a peel pack. And things that are in a lumen. Now, what's a lumen, right? Something that has a tubular aspect to it, right? Maybe a Yankauer suction device, something that has a tubular aspect to it. So anyways, if you're flashing something, the temperature, 3 minutes for an unwrapped. And I would remember this. 3 minutes for an unwrapped item in a flash sterilizer. Now, typically, it will be at 270, 27 psi, and unwrapped will be a minimum time of 3 minutes for an unwrapped item. Something just by itself in a tray, right? Now, it's 4 minutes for something that's wrapped. Right? Keep these parameters in mind. So if you have CST questions saying on a flash sterilizer, what is the time for a wrapped item? Right? 4 minutes. And something that has a lumen will be 10 minutes. 3, 4, 10, right? Easy numbers. So just to kind of recap on that, steam sterilizer, economical, very hot, higher temperatures than an ETO. Gravity equals cycles. It will be at a temperature of 250. And all this will be running on about 27 psi. I believe a pre-vac will be about 12 to 15 psi. And we'll go over that a little bit later. But flash sterilizer, what's a flash? Something that you need right away. You never flash like implants. That's a no-no. A Bowie-Dick test is something that's the most reliable way to verify that there's no leakage and you have the proper pressure, right? 27 psi. Pre-vac is at 270. The biological indicator bacteria is the Bacillus sternothermo, right? And 3 minutes for unwrapped, 4 minutes for a wrapped, 10 minutes for something with a lumen to flash an item right away. So you can see there, they're working at a higher temperature at lower times, opposed to where, this is a little bit longer for the process at a lower temperature. Okay. Now, some other options here. There's two. They have a STERRAD system and a STERIS system. Yeah, STERRAD is STERRAD, and STERIS is STERRIS. Both ways to process certain items. Now, when it's rubber, now let's go kind of these two items I want you to remember. If you think of a STERRAD system with a D on the end, you're thinking of hydroperoxide. Has this bubbly action to it. So when you think of STERRAD with a D, think hydroperoxide. STERIS with an S, think of parasitic acid. Those are the two compounds within those two systems, or two sterilization processes. Now, STERIS system, they're both. Now, when I think of STERRAD with a D, hydroperoxide, I think of things that are with like a rubbery items. But they're for sensitive items. For instance, the STERIS system, parasitic acid, are also used for scopes. So sensitive items that can't go in steam because they'll be damaged, right? And I would believe the time parameters for a STERIS system for parasitic acid for scopes are 30 minutes. So when you think of how long it would take to actually process something, 30 minutes is what you should answer on a CST exam. But why don't someone out there in that YouTube world, why doesn't someone out there in that YouTube world verify that for me, okay? And all this information here, fact check it for me. Don't confuse for sterilization, but for disinfection, right? To disinfect something. There's low level, there's high level, and there's intermediate levels for on CST exam. So we'll start off with a low level. Typically, if it doesn't have the ability, it has no spores, you can use a low level disinfectant. That usually is for CST questions. So they'll say something, what type of disinfectant would you use if it does not contain spores? Right, something that is a low level disinfectant. So why don't you do some research on what a low level disinfectant is out there and see what kind of answers you get in the comments. High level disinfectant, right? Cydex. Do you know the other name for Cydex? Who can pronounce that word? Anyone? Glutaraldehyde, right? Now, that is a high level disinfectant. So when they bring instruments back, they'll soak it in this glutaraldehyde, otherwise known as Cydex, right? 20 minutes is also what I want you to say. 20 minutes is what we actually soak this for. You can soak it overnight up to 10 hours. But typically the minimum time is 20 minutes. You can soak it in there. But I wouldn't leave it in there any longer than 10 hours. Especially if it comes in on a call overnight, you want to leave it soaking. But high level, think glutaraldehyde, right? An intermediate type of disinfectant, you probably can't see it over yonder there, is isopropyl alcohol, otherwise known as rubbing alcohol, right? All these are disinfectants. So low level disinfectant contains no spores. High level disinfectant, 20 minutes that it can soak as instruments come back. 20 minutes is the time frame, or up to 10 minutes. Glutaraldehyde is the name for a high level disinfectant, otherwise known as Cydex. And you will have that question out there. What is another name for glutaraldehyde? Cydex is the answer, right? Intermediate is isopropyl or alcohol, or rubbing alcohol is an intermediate type of disinfectant, right? If you guys have any questions about sterilization, maybe you can fact check me. I'm only doing this video for my class, but if you have any questions about sterilization, I know there's a bigger, large, broader spectrum of sterilization. But for CST purposes, why don't you throw it in the comments there? Anyone that's a surgical tech, anyone that works in healthcare, especially the OR, or even a sterilization, let me know what you guys do out there. Do they use ETO still? What's the most common thing? Is any of this right? I think it is. But hey, in the comments, tell me what you guys want to see. I think you want to see draping or draping techniques. But if you're interested in a dissection that we did with Dr. T, watch that video right there, right? I'll pin that link somewhere up at the top there. Otherwise, subscribe to my little face down over here, and the next video will be right over here. Otherwise, thanks for watching.
We are back with 3 CST questions. There's a new format that I'm going to do. I'm going to give you the question, give you some time if you want to push pause, answer it, but eventually I will let you know what the answer is after I give you the question. So it really is a kind of look at the answer it the best of your ability, but the answer will be at the very end of the question after I read it. That's the only way I'm going to change that now. Anyways, 3 CST questions. If you're new to the channel, please subscribe and like this channel. It helps me with the algorithm. Get this information out there to all the students, anyone that might be interested. But anyways, if you're on this one video, it's about CST. What is CST? It's the Certified Surgical Technologist exam. It's a national exam. It's not mandatory in some states. It soon will be mandatory, but it means more money. It proves you know what you know, right? And most employers are looking for certifications. So there's a lot of resources out there, but obviously a lot of people are trying to get. So I'm just putting 3 questions up there for your reference and kind of doing it that way. If you have any suggestions about what you want to hear, questions you want to talk about, just put them in the comment sections. If you're a student here at Southern Technical College, just ask me in the hallway. All right. Anyways, the first question, again, I'm going to read that question. I will put it up right in front of my face here so you can see it. You answer it. Push pause if you want to give a little time to look at it. But just remember, I am going to give you the answer as soon as I'm done reading that question. 3 of them. And then I will eventually put a extra question at the very end, kind of a bonus question to see if you guys stick around to the end. All right, I'm going to jump right into that first question, okay? This is kind of a microbiology edition, right? Microbiology, your favorite. Gram-negative, question number 1. Gram-negative bacteria has a what? Is it A, thick wall and stained purple? Is it B, thin cell walled and stained purple? Is it thick cell walled and stained pink? Or is it D, a thin cell wall and stained pink? Right? If you don't know a little bit about gram-negative and staining in general, we're trying to find the different thicknesses of that cell membrane, right? Based on the actual cell makeup, right? Help you determine what type of antibiotic. But anyways, what do you think that answer is? Pause it if you want to look at that question a little bit more. It's coming off the screen right now. It's gone. And the answer, based on the CST exam, is D, a thin cell wall or stained pink. And that's for gram-negative bacteria. If you think I'm wrong, let me know. All right, on to the second question for microbiology. All right, question number 2. Microorganisms that are facilitative anaerobes. Is it A, can survive only in the presence of oxygen? Is it B, cannot live in the presence of oxygen? Is it C, can survive with or without the presence of oxygen? Or is it D, none of the above, right? Anaerobes, anaerobic, right? What do you think that answer is? Push pause if you want to think about it, but you should know what the answer is. Anyways, the answer is C, can survive with or without the presence of oxygen, right? Not a good type of bacteria. All right, you stuck around, all right. All right, question number 3, moving right along, put that up on the screen. Bacteria spores are resistant to A, heat, B, drying, C, chemicals, or D, all of the above? All right, off the screen, I give you 1, 2, 3. The answer is all of the above. They're resistant to all of them: heat, drying, and chemicals. That's why that's why spores are difficult to get rid of, right? All right, that is microbiology, 3 questions CST. You stuck around for the last one, bonus question. Just kind of a suggestion, if you can like and subscribe, is really going to help me out. But we're looking for contact hours. You help me get to over 1,000 subscribers, you watchers out there throughout the world. But I need contact hours. That means you need to put all your videos on loop and just let them play, because Brad has to retire soon. Now, if you can watch these videos, share these with friends, suggest what you want to see. I think I'm going to have a lot more draping videos, a lot more kind of hands-on types of stuff. I've done some instrumentation videos on this website or on this YouTube page. But I want to have more draping. I think that's a lot of things what students want to see is draping techniques. So I think the next edition will be some draping series, right? Do I have the question in mind? Not really. I have to go find it. All right. The bonus question that involves microbiology for surgical technology. Bonus question, you stuck around to the end. Microbiology. The question is, put it up on that screen. We're going to do it real quick here. Chemical agent used to kill microbes, including spores, that is used only on an inanimate object, is what? Is it A, a disinfectant? Is it B, sporcidal? Is it C, antiseptic? Or is it D, a glutaraldehyde, right? Keyword is spores, right? Push that pause button. What do you think that answer is? Well, I'm going to give you the answer. And 1, 2, 3, it's D, glutaraldehyde. That's a high level disinfectant, kills spores. They'll pretty much kill everything. Once you watch these other videos, which are right there and there, and watch you push my little face there and subscribe. Make sure you share and like. Go like everything, and make sure you get that 4,000 watch time. Just put them on loop. Just loop it out nighttime. All right, see you next time. Bye-bye. Well, it's been a while. Have you missed me? Probably not. I have been under the weather, but we are back with some CST review. If you're not familiar, obviously I have a series on YouTube here with just 3 CST questions, trying to get CST exposed out there to the public, students, etc. Saw some of the comments in there about giving 10 questions. So that's today. We're going to give 10 questions of CST, and the format I have is, well, I will read the question, put it up on the screen so you guys can see it. If you want to pause the video and try to answer it, that's great. And obviously we're going to kind of go through that, keep this under about 10 minutes is my goal. Okay, so first question that we're going to read. Now CST, these questions are all over the board in a sense of subjects, so it's not really defined of pharmacology, sterile process, and there's going to be a random of questions on this video. So first question, we're going to jump into it. Okay, number 1, and we'll put that on the screen right now. Bladder, a bladder hernia that protrudes into the vagina, into the vagina wall is called a vagocele, anorcele, cystocele, or a rectocele. So it protrudes into the vagina wall, right, from the bladder. Well, the correct answer is C, cystocele. That is a rupture of the bladder into the vagina, right? C, cystocele. First question, put it up on the screen, and we're going to read it right now. Here we go. The cranial nerve that is responsible for vision. Is it A, olfactory? That was my reminder. Is it B, the optic nerve? Is it C, the transgeminal? Or is it D, the vagus nerve? Again, if you don't know, we're going to tell you the question, show you the question on the screen. Push pause if you want to try to answer it, but I will tell you the answer at the end of the question. In this case, it's B, the optic nerve is responsible for vision, right? Question number 2, in a total abdominal hysterectomy, bilateral salpingo-oophorectomy, all of the following self-retaining retractors are commonly used except. Is it A, the Belfour? Is it B, O'Sullivan O'Connor? Is it C, Wheatlander? Or is it D, Bookwalter? Now, before you answer that, it says except. And obviously you can see on the question that they abbreviated it, right? And that's a total abdominal hysterectomy. BSO stands for bilateral salpingo-oophorectomy, right? Self-retaining retractor are commonly used. Think about it. Well, it's the Wheatlander is the answer because it's small and is not typically used in large cases, right? It's usually for small incisions. O'Sullivan O'Connor is a large self-retaining retractor, Belfour, and the Bookwalter is the largest of them all, right? Can be used in any of those scenarios, but Wheatlander is not commonly used. Right? Moving on to the next question. Question number 3. Which procedure? Love how they spelled that. Procedure. Question number 3. Which procedure is commonly performed with a pyloroplasty? Say that 10 times. Pyloroplasty. Is it A, a partial gastrectomy? Is it B, a vagotomy? Is it C, a cholecystectomy? Or D, a Whipple? Commonly used. What procedure is commonly performed with a pyloroplasty? Do you know what that is, Barlora? Answer is B, a vagotomy. Believe it or not, that is the vagus nerve. And obviously the pyloroplasty is a stenosis or narrowing in the pylorus, which is the end part of the stomach before it goes to the duodenum. They'll make an incision in that muscle, and obviously they'll make an incision in that pylorus muscle to relieve the stenosis within the pylorus. Now, the vagotomy part about it is sometimes in conjunction they'll isolate that vagus nerve. Maybe there's an increase of gastric juices that are forming. So vagotomy is typically commonly performed with a pyloroplasty. So do some research on that. Pyloroplasty and vagotomy involves the vagus nerve, right? Otomy, vagus, vagotomy, vagus. I didn't spell it. That's just what it is. Question number 4. Put that up on the screen as soon as I find it. So, question number 5. During an orthopedic surgery intervention, bone wax is used to do what? Is it A, heal bone or help to heal the bone? Is it B, prevent bone infection? Is it C, seal off oozing blood? Or is it D, provide support to the bones? What do you guys think? Pause the video, try to answer it. I'm kind of limited it down to 2 here because they kind of both make sense. Give you a second. The answer is obviously C. You want to seal off oozing blood off of bones, but does it help the heal the bone? I guess in a sense, but really it's not helping to heal. It really is it's a hemostatic agent or a mechanical hemostasis is bone wax. But by definition, obviously test purposes, you want to seal off oozing blood in any aspect. So, question number 6. Who is responsible for instruments, sponge, and sharp counts? And obviously these are people that do the count. Who is responsible for that? Is it A, the circulator in the CST? Is it B, the surgeon in the CST? Is it C, the circulator and the assistant? Or is it just you, D, the lonely CST? What do you guys think? Pause the video if you want. Who is responsible for doing counts? Correct answer is A, the circulator and the CST, okay? You are typically responsible for doing a count. The question is, how many counts do we do? Typically, 3 counts. When do we do that, right? The initial count, when we close up the peritoneum, and then we close up that final count, the skin layers. The other question you should be asking yourself, when do you do 4 counts? Look it up. There is a scenario. 4 counts. What are we on? 5 or 6? I don't know. Going on to question number 7. Put that on the screen here. Let's rock and roll. The study of drugs and their actions on living organisms. The term is pharmacodynamics. Is it A, pharmacodynamics? Is it B, action potential? Is it C, pharmacokinetics? Or is it D, pharmacogenetics? The study of drugs and their actions on living organisms. Give you a second to answer that. 1, 2, 3. Told you to pause it. It's A, pharmacodynamics. That's the action on living organisms. Pharmacokinetics is actually the movement of drugs, right, through your body, all the way through the excretion. Anyways, A was your correct answer. Pharmacodynamics. Pharmacodynamics. Question number 8. We're moving right along. The ligament that is used as an anatomical landmark to identify the end of the duodenum, or is it duodenum? So the landmark to identify the end of the duodenum. Is it A, a round ligament? Is it B, cardinal ligament? Is it C, the ligament of Treitz? Or is it D, the crucial ligament, right? Give you a second, right? A landmark, anatomical landmark. Answer is C, the ligament of Treitz. So think about that when they're trying to run the bowel in an open surgery, right? We're running the small bowel, typically the jejunum, right? That's our, obviously we're looking at the duodenum, the jejunum. They want to know where that begins from the jejunum. So there's a ligament that attaches the jejunum to your diaphragm. It's a landmark that they look for when they're running the bowel in open kind of abdominal surgery. Question number 9. Moving right along. The robotic arm on a Da Vinci machine or remotely controlled hand is called what? Is it A, a telechair? Is it B, a cylinder? A C, a manipulator? Or is it D, android? Give you a second to think about that. Da Vinci, they got these arms. They manipulate things, so they're manipulators, right? That is the correct answer. C, manipulator. Question number 9. If a patient's heart rate drops below 40 to 50 beats per minute, otherwise known as bradycardia, which medication could be administered to correct the problem? Is it A, epinephrine? Is it C? Is it B, sodium bicarbonate? Is it C, atropine? Or is it D, palbociclib? So this is a medication that they'll give you for bradycardia. The correct answer is A, epinephrine. And sometimes we'll have that available on our field. I would say lidocaine typically can also be stimulating cardiac. But epinephrine is a vasoconstrictor, right? And sometimes they use that for any kind of bradycardia scenario. All right, you made it to the end. We're on 10. Question number 10. Question number 10 is a pretty easy one. Let's rock and roll. A surgeon would wish to administer heparin to do what? Is it to dissolve the clot? Is it C, locate the clot? Is it B, locate the clot? Is it C, prevent the clot? Or is it D, promote clots? What's the purpose of administering heparin? And that is going to be C, right? You want to prevent clots, right? We don't want to have the operative field full of little clots, right? So you thin that blood out the best you can. You can give that systemically by anesthesia, or you can have that on your field in a heparin saline kind of flush with a 10 cc syringe. Hopefully that was 10. Anyways, you made it to the end. I'm falling. you made it to the end. I appreciate it. And I apologize for not putting videos up. I will continue to put up CST types of questions. Why don't you suggest any kind of videos you're looking for? Obviously, we're trying to put up CST types of information. I haven't been in the lab lately because I have not had a class this term. So we've been doing a lot of externships in CST prep. Anyone that's out there that's doing CST, I actually recommend you suggesting some information that you want to see or any types of questions. But keep studying. Breaking down these questions are important. The more you're exposed to CST, the better you'll get at it, because it is a broad spectrum of information. To try to have all that information in your head at one time, I know it's very difficult. If you don't use it, you'll lose it. And sometimes you ask yourself, why do I need to know this? Yeah, we need to know it for one reason alone, for the test, right? Obviously, if you want to further your career, that's a good thing. But a lot of these questions is about exposing yourself, breaking it down, limiting it statistically about knowing everything there is about questions. So if they ever reword the question or throw some scenario, at least you eliminated the idea of studying down to every scenario. So at least you have a higher percentage of passing, right? So just to reiterate, the test is actually, it's 175 questions, if you didn't know, and we throw out 25, not me, obviously the MBS TSA, for different review, trying to develop other questions. So it's really out of 150, right? They lower that standard a little bit. Doesn't mean that you don't study as much, but they lowered the standard a little bit. Used to be 102 to pass. It's now 98 to pass, which is a 65%. So I always say it's kind of hard to not pass, but that being said, make sure we try to maximize our effort at studying. That's important. Trying to, if you're in class right now, to look at anatomy, look at a question-based, CST question-based on the subjects you're trying to learn. Give an example. If you're going over anatomy, try to isolate what CST is asking you on basic questions. So if you're taking out a gallbladder, you should know the anatomy around there, right? Cystic duct, cystic artery, we're ligating those two areas. Do you know what that triangle is called for the actual gallbladder surgery? So trying to understand questions based on, especially when you're out at externships, if you're doing a neuro case or laminectomy, try to associate questions when you're in there in surgery. Doesn't always happen that way, but that would be my advice when you're trying this study. Give me your tips. How are you studying? But anyways, hopefully you enjoyed the 10 questions. I find it a little bit more difficult trying to get 10 questions out myself, but hopefully there was 10. Did I miss it? And do you need a bonus one? Did you stick around? Are we at 10 minutes? No, we're not. We're at 9 minutes and 19 seconds. So let me give you a bonus question for anyone that stuck around to the end. Anyone that logged off, that's so 1990. Anyone that did not watch to the end of the video is going to miss out, right? So let me find you another question real quick. Anyways, you stuck around to the end. Let's try to get this question up real quick. I'm not going to pull it up real quick. It's in the top of my head right here. Malignant hypothermia. And I see this question all the time. There's two scenarios in it. Do you know what malignant hypothermia is? And what is the treatment for malignant hypothermia? Also, what is the trigger for malignant hypothermia? I give you two of the answers there. Treatment, dantrolene, right? Reconstituted dantrolene is the treatment. That's spelled D-A-N-T-R-O-L-E-N-E, dantrolene. And the trigger is a muscle relaxant called succinylcholine, otherwise known as Success. It's spelled Success. Anyways, you stuck around. And I'll see you next time, guys. 10 questions. That's probably our goal now. We'll see how you respond to this. Don't forget to like and subscribe. You'll see my face somewhere in here. And obviously there's some other videos on that side. Check them out. Share to your friends, to your mother. Just share the videos. Otherwise, I'll see you next time. Bye-bye. Well, welcome back to CST Questions. We're going to do 10 questions for CST exams. We're going to try to get through this as thorough as we can. as quick as we can, about 10 minutes. So why don't you join me a little bit about CST, and hopefully you guys are studying out there. We have 14 students that are about to take their CST exams. They're nervous. They're thinking, do I know everything? If you put in that work, you studied, you tried to eliminate all kinds of scenarios, you should do fine, okay? But you join this video, we're talking about CST questions. We're going to do 10 CST questions. If you're not familiar with the format, typically I read the question, I'll put it up on the screen, I break it down, I'll tell you A, B, C, or D, and then I'll give you some time to think about it. If you want to pause the video to answer it, because I will tell you the answer as soon as I'm done with that question. So 10 questions, we'll jump right into that, and let me find the first one for you, okay? And also, don't forget, that helps me out with the algorithm. Why don't you like and subscribe? That helps with that algorithm, gets that video out there, helps me out personally to try to spread this information. So like and subscribe if you can. Hit that bell icon. All right, on to that first question. Is my head turned to the side? It is turned to the side. All right, on to that first question. Put that up on the screen right now. Here we go, all right? All of the following are factors affecting the choice of sutures purchased or used, except. Now, if you look at that, it says except, right? So make sure you stop and read these questions. Don't assume, because most people will start reading the beginning, I got the answer, and answer it. Now, read it all the way to that end, all right? It says except, right? Is it A, cost of a suture? Is it B, surgeon's choice? Is it C, the presence of infection? Or D, patient gender? Which one, right? Give you a second, pause that video. The answer is D, right? It doesn't really matter what your gender is, right? Does not influence the sutures. All right, good. On to that second CST question. All right, put it up on the screen. 1, 2, 3, go. Put it up on that screen. A Jennings or a Jennings mouth gag is used in which of the procedures? In which surgical procedure? Is it A, a TAH? Now look at it, they're all abbreviated. I think when you look at that, you start to surgically map this question. You want to make sure you know what abbreviations are, right? Really important to know what abbreviations are. So is it A, TAH? Do you know what that stands for? Is it B, a DNC? Is it C, a TNA? Or is it D, TERP, right? We're looking at a Jennings mouth gag. Which would that of those options used in which procedure, right? I'll give you a minute to think about it. It's C, TNA, right? And I'll let you guys look that up. Make sure you know what those abbreviations are, okay? I can tell you, but I'm going to give you a chance to look it up on your own, okay? On to that third question. Take off the second one. Hopefully I did that already. Put up the third one right now, right? Put up that third one. A tissue formation in the proliferation stage of wound healing by first intention. Now this confuses a lot of people. Is it A, second phase? Is it B, the maturation phase? Is it C, the first phase? Or is it D, the lag phase? So when you kind of study wound classifications, wound healing classifications, I think it falls into two scenarios, where wound closures, which is first, second, and third intention. And then there's wound stages of healing, right? Inflammation, proliferation, maturation, and remodeling, right? In this case, the proliferation stage, which wound healing is by first intention, right? It's going to be in that second stage. Proliferation is kind of typically right after inflammation, right? Look up the difference of those wound healing, or suture closing and wound closures, first, second, and third, and then there's wound phases of healing. Don't confuse those two, okay? In this case, A was your correct answer on that. Pretty simple one. I'll give you a simple one. Throw it up on the screen. If you don't know this, well, I'm a little concerned, but I still like you out there. In accordance with OSHA, do you know what OSHA is? Regulations. Protective eyewear must be worn when? Is A, on some cases? Is it B, only where there's a lot of bleeding is expected? Is it C, all the cases? Is it D, on only HIV cases? When should you wear protective eyewear, otherwise known as PPE, protective equipment, right? It should be all the time, right? You should always wear protective equipment, no matter what. HIV, non-HIV, hepatitis, it doesn't really matter. Protect yourself, right? Assume like everyone is contaminated, right? Answer is C, all the cases. That was a pretty easy one, right? I've seen that all the time. On to the fourth question. Let's see if I can lose track of my questions. We're on 4, right? 4, 1, 2, 3, 4. All right, here we go. Fourth question. The procedure performed to remove ovaries or remove the ovary is what? Is it C? Is it A, cystectomy? Is it B, oophorectomy? Say that 10 times. Cystocele or oophorectomy, right? So which one is the removal of the ovaries, right? The answer is D, oophorectomy, right? Salpingo oophorectomy. Salpingo, right, is the tubes, and the ovaries are the oophorectomy. Oophorectomy. Salpingo oophorectomy. Stop saying oophorectomy. Okay, on to the fifth question. Pretty simple question here. When cutting sutures, only use the tip of a blank scissors, right? When you're using sutures, should be muscle memory, right? Hand that needle to the doctor, right? The suture to the doctor. You should have Atson with teeth. What type of scissors should you have, right? Is it A, the iris? Is it B, a straight Mayo? Is it C, a Metzenbaum? Or is it D, curved Mayo, right? You should know it's B, the straight Mayo scissors is typically used for cutting sutures, right? Pretty easy question. Let's go on to number 6. Number 6 is during a neurosurgery, once the duro has been exposed, the appropriate sponge to hand to that surgeon is a what? Is it A, a Kittner? Is it B, a 2x2? Is that a real thing? Is C, cottonoid? Or is it D, a Raytech? What is the most common sponge used in neurosurgery? And the answer is C, a cottonoid, right? Otherwise known as a peanut. No, it's not a peanut. A cottonoid. Don't confuse those with Kittners and peanuts. Those are for blunt dissection, right? C, cottonoid is your answer. On to number 6. Question number 6. Put it up on that screen. The prefix contra means what? This is medical terminology. You'll have some medical terminology questions on the CST. You should know your prefix, your suffix, and your root, right? Typically. In this case, is it A? Does it mean down? Is it B? Does it mean difficult? Is it C, against, or D, abnormal? Contra, the prefix contra. In this case, it's C. It means to be against something. Contralateral, right? It means to be against. What am I on? Question number 8? I hope so. That's what I'm going to go with. Question number 8. These 10 questions are tough. Can't keep track of the number I'm on. For God's sakes. In this case, question number 8. During a spinal surgery, the following elevator is used. So we're talking about neuro, right? Hopefully you know your instrumentation, right? Is it Cottle? A, Cottle. Is it B, the Lemberg? Is it C, the Doyen? Or is it D, a Cobb elevator? So what elevator is typically used in spinal surgery? Give you a minute to think about it. You should know the Cobb elevator is a large elevator used in a lot of spinal surgery, right? Manipulation of that. Give you an example, a laminectomy, right? They're manipulating that back. Maybe they're scraping off some periosteum, right? Cobb elevator. Question number 9. Question number 9. The artery located in the back of the knee. This is an anatomy question. So you need to know anatomy, right? You need to know sterile processing. Wow, we have to know a lot of stuff for CST. For God's sakes. Question number 9, right? The artery located in the back of the knee is what? Is it A, the femoral artery? Is it B, the popliteal artery? Is it C, the radial artery? Or is it D, the tibial artery? What is the artery that's behind your knee? In this case, it's B, the popliteal artery, right? So slow down, you will have some anatomy questions, right? That's probably an easy one, right? Where's the femoral artery? Do you know where that's located? Do you know where the radial artery is? Probably right down somewhere in your hand and right next to your medial nerve and artery. What are we on? 9? For God's sakes. Question number 10. Let's finish this up. Even if I'm not on 10, I'm going to stick with 10 at this point. The name of a position. I can't read. The name for the position when a patient is placed on his or her stomach. Oh God, that's so easy, right? Do you know your positions? Supine. Is it A, supine? Is it B, prone position? Is it C, dorsal recumbent? Is it D, lateral kidney position? Right, in this case, we know if we're laying down on our stomach and our face is down, we're in the prone position, right? These are easy questions. I wouldn't just stop there. I would say, all right, what are some things we need to protect nerve-wise? We're in prone position. Is it your radial nerve or is it your ulnar nerve? In this case, that's the radial nerve we need to protect because our arms are hyperextended outwards, right? So now we're protecting the nerve that runs along the thumb. Not here, your thumb. So what about supine, right? Same thing. If we're in supine and our arms are tucked in, right, we have the ulnar nerve we have to protect now, right? Dorsal recumbent is really just another version of supine. Lateral kidney, you're on the lateral side, right? So know your positions, know some of your nerves you have to protect. In this case, the question is, prone is your face down, right? Question, I'll give you a bonus question and we'll finish this up real quick, okay? All right, this is a bonus question, or it could be 10. I'm not really sure, but either way, let's finish this up real quick, okay? Prior to a total abdominal hysterectomy, which type of catheter might be inserted? Is it a Foley? Is it a Fogarty? Is it a Malcott? Or a Pelzer? All right, do you know those catheters? What's the most common catheter? Obviously, it's A, Foley catheter. Do you know what B is? A Fogarty catheter? What about a Malcott? So when you look at these questions, and I'm going through them pretty quick, it falls on you to kind of go over it. I can sit here all day, right, and kind of go over these questions. It's called surgically mapping these questions, eliminating options, understanding all the options that they're actually providing you, right? It's going to help you long term to understand what the answer might be, because I'm not sure how they're going to word these questions. You might think Fogarty might not be on a question, but it will, right? They might reword this and use some of these options. So it's in your interest, it behooves you to eliminate all this and understand the best of your ability, everything, right? So I'll give you an example. Throw that one more question up and I'll kind of tell you what I'm talking about. Prior to a total abdominal hysterectomy, I would stop there. Do you know what total abdominal hysterectomy means? Right? Obviously you should, but when you're reading the question, start there. Because if you don't, right, you could be just guessing. And obviously you can use what they call a process of elimination and try to eliminate some of these. And I would try to do that also. That's a good technique. But when you study, you need to start there. With the question, if you don't understand a word, you need to look it up. For God's sakes, Google it. Jesus. Yeah, you can use Jesus too. Yeah. Anyways, that's it, right? 10 questions. Hopefully that was 10 questions. Don't forget to subscribe and like. That helps me out, helps with the algorithms. Helps me out. Don't log off right now, right? Like, subscribe. There's my little bell. And there's some other videos you can watch. This is a playlist, so go through this playlist. I think I have about 10 videos that you can go through a bunch of these questions, right? Just kind of skim through them. Send me your comments. Send me your suggestions, right? Helps me out. What are you guys looking for? I'm just throwing some random questions out there to kind of expose you to it, right? Also on the community, I put up questions up there and I see that a lot of people do answer those questions. So anyways, thank you for joining us and I'll see you next time. Bye-bye. Well, you clicked on this link because you want CST questions. Well, this is an extension of my playlist I have, which I kind of read questions just to give you a little, kind of catch you up to the format I have here is I will read 10 questions, and these questions are right off of the exam B, or practice exam from the CST. They always provide this, but there's always a variety of questions that they try to pop out on their website. But I'm going to read you 10 questions Format is, I will pop it up on the screen, read it to you, break the questions down within reason, but I'll let you know what the answer options are. This is multiple choice. Pause it if you want to try to answer it, because I'm going to let you know the answers as soon as I read that question. I'm going to get through 10 questions. I don't want this to be long because most people fade away after about 3 minutes. Let's keep this about 10 minutes long, okay? Let's jump right into that. Before we start, if you can like and subscribe, or trying to get this page out to the students helps us out, helps me out personally on this YouTube page, and helps us try to get information out to students. So like, subscribe, here's a little subscribe button, hit that bell icon, all of the above. All right, no more soliciting. All right, first question, right? Gonna read it to you. Put that up on the screen right now, right? During which of the following surgeries is a Meckel's diverticulum typically discovered? Is it A, a hysterectomy? Is it B, an appendectomy? Is it C, a prostatectomy? Or D, a varicocelectomy? So think about it, push pause. What is Meckel's diverticulum? Do you know where that's located? Well, I do. Do some research on that. It's a commonly mistaken for an appendicitis. It's a diverticulum that's inverted, and it is a diverticulum that's inflamed and a little bit larger. So B is your correct answer. Meckel's diverticulum. Do you know what Zeckler's diverticulum is? Look that up. This is an unusual type of question that I don't see very often, but I'm going to read it to you. Question number 2, right? When preparing the STERRAD sterilization system for use in a surgical area, which of the following outlets must be available? Weird question. Is it A, the suction? Is it B, the oxygen? Is it C, nitrogen? Or D, the electrical outlet? Well, if you don't know, you stick things in an electrical outlet. Yeah, they're going to use an electrical outlet as an option. I just thought that question was weird. I've never seen that, and this was on a ASD practice exam. Do you know outlets? Do you know AC current? Do you know DC current? What those stand for? Alternating current or a direct current. Yeah, so D was your correct answer on that. Let's move on to question number 3. When you put it up on the screen. When can an instrument count be admitted? This is another kind of weird question. Is it A, if the incision is too small for an instrument to become buried? Is it B, when the surgical technologist in the circulating role becomes too busy? Is it C, if the instruments are needed in another operating room? Or D, when the patient receives outpatient surgery? Now, typically I tell students the only time you can admit a count is in an emergency. But in this case, A is your correct answer. If the incision is too small, right, you can admit a count. But I guess the key word is instruments. Instruments, right? Not a soft count, not laps, not ratex, right? So when instruments can be admitted, usually is because you're doing laparoscopic, or they're not in a cavity, or you're not going to lose these instruments, right? So A is your correct answer on that. Question number 4, we'll put that on the screen right now. A specimen obtained for frozen section is generally removed from the sterile field intraoperatively because, is it A, needs to be labeled by the circulator? Is it B, is sent to pathology immediately? Is it C, we contaminate the sterile field? Or is it D, needs to be placed in formalin solution? So the specimen obtained for frozen section is generally removed from the sterile field intraoperatively because, why are we doing that? What is frozen? Why do we need that? Yeah, that doctor needs that specimen to be sent down right away. It needs to be dry. They're going to freeze it, and they're going to splice that up and check for cancer typically, check for margins. So B is sent to pathology immediately. Otherwise, everyone in that room is just standing there looking at each other, waiting for the news, and I've been there before, right? So B is your correct answer. Question number 5, we'll put that on the screen right now. Which of the following is the most common complication of a strangulated hernia? All right, do you know your hernias? Is it shock? A, shock. Is it B, necrosis? Is it C, infection? Is it D, hemorrhaging? So what is the most common complication? If you know strangulated hernia is exactly what it sounds like. You're strangulating the vascular supply. Not incarcerated, it's strangulated. So if you cut off blood supply, ischemic, things are going to become necrotic and die, right? So that's a complication. So typically you probably want to have staplers available and get ready for a resection or a colon resection of some kind, right? So B is your correct answer on that. Question number 6. Question number 6. As I got something on my screen. Question number 6. Put it up on the screen right now. Is a steam autoclave set on prevac? So we're a steam autoclave set on prevac. The minimum temperature that it must reach is what? 200, 230, 250, or 270? And now I've gone over this with class about steam, ethane oxide. Ethane is usually a lower temperature. Steam typically is a higher in the 200s, but they break it up into 2 categories. Gravity displacement is typically about 250, and when you get into the prevac, you're at a higher temperature, and that is D, 270, typically 270, right? 27 psi, probably for 30 minutes. I've seen that on some exams. But with this question, this answer, it's 270. That's the minimum temperature you want it to be at, right? Hey, if you guys stick to the end, we're going to have a bonus question. And again, don't forget to like and subscribe. It really helps me out. Hey, put some comments down there. Spread this to your friends. Let your classmates know about it. And tell me what you guys want to see for CST. How are you reviewing out there? Because I know a lot of people are having trouble reviewing. I've talked to many people about the CST exams. I've talked to instructors how they structure classes. There really is no easy way around it. You have to study. You have to try to retain this information. Do not try to memorize. Might be a place for memorization, but in the long term, if you truly understand what they're talking about, no matter how they reword these questions, you will understand those. So, and that's my pro tip of the day. And just for that, why don't you like and subscribe? All right, stop saying like and subscribe. Come on. All right, what are we on? Question number 7? Oh, Dios mío. Question number 7. Put it up on the screen. If it's not number 7, well, we're just going to roll with the punches here. Which of the following vasoconstrictors, hopefully that's on, which of the following vasoconstrictors is used to prolong the action of local anesthetic? Is it A, heparin? Is it B, some word we can't pronounce with an E? Is it C, lidocaine? Is it D, epinephrine? So which of the following vasoconstrictors is added to the local? Yeah, this is a first day on the job kind of scenario. Epi is added to local to help prolong the duration of most medications, Marcaine or lidocaine, right? Do you know lidocaine? And the difference between lidocaine and Marcaine is? Lidocaine is quick reaction, but a shorter duration. Marcaine is typically, takes a little bit longer to react, but a longer duration. So vasoconstrictor prolongs the anesthetic. Do you know what else it does? Yeah, so it's also going to help with hemostasis. Since it's a vasoconstrictor, it's going to reduce blood loss or bleeding around incisional sites, especially trocars. Try to sew up those trocars when it's bleeding like a sieve, right? Do you know what a sieve is? Question number 8. Put it up on the screen. Which of the following surgical procedures may be used to remove a carcinoma from the head of the pancreas? Yeah, is it A, Heller? Is it B, the Whipple? Is it C, Bankart? Or is it D, Billroth 1? Now, I told students all along, every time you have pancreatic cancer, Whipple is involved, but it's always in the head, typically in the head of the pancreas, right? Looking at the other options there, Bankart, Billroth, these are all, Bankart's a shoulder. Billroth is really a gastrotomy, maybe stomach cancer, where you're reconnecting the duodenum to the stomach. And Heller, hell did I know? I don't know what Heller is. And why don't you Google it and put it in the comments if you know what a Heller is. Is it Heller Keller? I don't know. Anyways, that was question number 8. Oh, it's right there. Heller is a myotomy procedure. It's I don't know, it's an incision in muscle. Well, that's not really a good explanation. I'm going to look it up. I'm not sure either. Question number 9. Retention sutures are advantageous when a patient is... So when should we use retention sutures? Is it A, pediatrics, B, some athletic patient, C, thin, or someone that is obese? The correct answer is obese, right? Retention sutures are going to prevent eviscerations, dehiscence, right? Something that has a tendency that the sutures will separate, that approximation wound closure will separate. Retention sutures with bolsters typically will prevent it going into the skin. Retention sutures are going to help prevent dehiscence the best of their ability. And that is correct. On to the next one. All right, question number 10, and stick around, I'll have a bonus one right after that, and the parathyroid gland regulates. So question number 10, put it up on the screen. The parathyroid regulates. The parathyroid gland regulates. Is it insulin, calcium, sodium, or
aldosterone?
I don't know that word.
Aldosterone.
I will sub it in. Or D.
Aldosterone.
So what does a parathyroid regulate? So this is really important. Do you know how many parathyroids we have? We have 4, right? Okay, so what does it regulate? If we suddenly don't have a thyroid, we're not going to get good calcium absorption. So it regulates your calcium throughout your body. That's CST 101, right? Do you know, if you're doing a thyroid, what nerve you have to protect? Yeah, that's a recurrent laryngeal nerve, right? Stick around for the last question, the bonus question. Before I find that question, hey, thank you for just staying to the end. But surgically map these questions, understand everything there is about it. Just expose yourself to as much information as possible. That is my advice. So the last question, bonus question, you stuck around. Here we go. Right, pretty simple question. We'll leave you with an easy one today. All right. Which of the following is true regarding the care of ratchet instruments following a surgery? Is it A, instruments should be soaked in saline? Instruments should be prepared for decontamination with curd tips up. Instruments should be opened and washed and sterilizing. And D, instruments should be sterilized in sonic washer. So, which of the following is true regarding care of ratchet instruments following the surgery? So, what should you do when the surgery is done and you're preparing instruments to go to decontamination? So, the instruments should be opened. This is C is the correct answer. Instruments should be opened, and hopefully you're spraying some enzymes on that to help with breaking down it, right? So, C is your correct answer. Kind of a weird question, but yeah. Instruments. So they're talking about instruments should be opened so all the debris can be washed away. That makes sense. So that's the key there. Open instruments. Otherwise, someone in sterile processing is going to have to do that, right? Don't put more work on the sterile processing department. All right, thank you for sticking around. Why don't you hit these videos? There's a whole playlist. Check them out. Just run them through. And I thank you for paying attention, class. As they say, as G.I. Joe, knowledge is key and knowing is half the battle. All right. Thank you for sticking around, and I'll see you next time. There's my face. There's some videos. Subscribe, like, all the above. See you next time. Bye-bye. Hey, it's me. It's Brad. I'm back. You thought I was dead, didn't you? No, not dead. I'm back. I'm back again. Here we go. Let the party begin. If you don't realize I am back, I want to try to do some more CST review. 10 questions. The format I have here on this page, and if you look on the playlist, I have numerous CST questions. This video is going to be about CST. We're going to have 10 questions. The format is I'll put it up on the screen, I'll read the question, and hopefully I'll give you the answer right after I'm done reading that question, and we'll just loop right into the next question. So pause it if you want to know the answer. Well, I'm sorry, pause it if you want to answer the question on your own, because I'm just going to go pretty quick here. I'm going to keep this about 10 minutes long. Stay with us. We're going to get these questions. We're going to jump into that right now. First question. Put it up on the screen. Here we go. What nerve is the greatest risk during a... What nerve is at the greatest risk during a thyroidectomy? Is it A, cervical sympathetic chain, Is it B, inferior laryngeal? Is it C, the vagus nerve? Or D, the recurrent laryngeal nerve? So what nerve is at its greatest risk during a thyroidectomy? If you don't know the answer, it is D, the recurrent laryngeal. Put it in the comment sections, why is that? What do you think? Did you surgically map that question? Question number 2 is, which nerve could be compressed against the humerus in a prone position? Is it A, the peroneal nerve? Is it B, tibial? Is it C, the brachial? Or is it D, the radial nerve? What nerve can be compressed against the humerus? What do you think? Yeah, you're right. It's D. You thought I was going to say A, didn't you? Is it D, the radial nerve? Why is that? You're in the prone position, and obviously we might be doing a laminectomy or something like that, where the arms are hyperextended going forward towards anesthesia. So now we need to protect the radio opposed to the ulnar nerve. So D is your correct answer. Question number 3. What is the surgical procedure for reducing testosterone in a prostate cancer patient? Is it A, vasectomy? Is it B, varicocectomy? Is it C, hydrocoectomy? Or is it D, orchiectomy? Every man's nightmare here. Yes, it's D, removing the testicles, orchiectomy, right? Prostate cancer, testosterone produced through the testicles. So removing those can reduce testosterone levels, especially prostate cancer. That's question number 3. On to question number 4. Here we go. Question number 4. Which of the following vessels arise from the right ventricle of the heart? Is it A, descending aorta? Is it B, ascending aorta? Is it C, pulmonary vein? Or D, pulmonary artery? Which of the following vessels arises from the right ventricle of the heart? You might have to draw it out. Unless you're one of those idiot savants who can just visualize that. It's kind of hard to. I recommend if you're taking this, write out the flow, draw out the heart in some aspect, chambers, atrium, ventricles, how is it flowing, right? In this case, the right ventricle, we're going into D, the pulmonary artery, correct? Yes, that is correct. On to the next question. Hopefully it's question 5, right? Question number 5. Which of the following has a legal significance in the mishandling of a bullet? Is it A, damage to tissues while removing specimens? Is it C, contaminating the specimen? Is it C, damaging the ballistic markings? Or is it D, tearing surgical gloves? Which of the following has a legal significance? Right, this is a pretty easy one, right? Anytime there's a bullet, you want to make sure you don't damage the ballistics markings. How do we do that? Right, we want to protect either a hemostat or something we're grabbing the bullet with maybe some suture boots or some shrouds, or maybe have a sponge, right? Make sure we do not damage the ballistics during surgery. C is your correct answer on that. And we're on to question number 6. Looks like the video quality is a little better too. Anyways, question number 6. Which stapling device would be used to create an anastomosis during a lower anterior resection? Is it A, the GIA? Is it B, EEA? Is it C, TA? Or is it D, LDS stapler? You know the answer? It's B, EEA. I would ask yourself, do you know what lower anterior means? What part of the colon? What's GIA stand for? What's EEA stand for? So, make sure you know what those stand for. I can tell you, gastrointestinal. EEA stands for end-to-end anastomosis. TA is thoracic abdominal. And LDS is ligation and dividing staplers. Look up what they're used for. They all have a purpose. In this case, an EEA is used for a lower anterior stapler. On to the next question. Question number 7. What is the lining? Question number 7. What is the lining of a thoracic cavity? The peritoneum, the pleura, the parietal, or the pericardium? What is the lining of the thoracic cavity? Yes, you should know this. It's the pleural cavity. How about B is your right answer on that. How about A? What does that mean? Periosteum. That's in your abdominal cavity, right? What's parietal? Parietal versus visceral, right? So visceral pleura is up against the organ or the lung, and the parietal is up against the actual chest or abdominal cavity, up against the skin, right? And in between there is the cavity. Pericardium is around the heart. Peri means around, and cardium is the heart. So there's a pericardium sac around the heart, right? It's important for you to break down and understand every option, because you never know. They might throw those questions, those options, as a question, right? So you're killing multiple birds with a stone here, trying to eliminate your options in the sense of what they might ask you. That was question number 7, and a long explanation. Too much. Stop talking. On to question number 8. Hopefully it's 8. If not, I'm going with it. 8. Which of the following is a part of the immune system? Is it A, the liver? Is it B, the spleen? Is it C, the pancreas? Or is it D, the thyroid? Which is a part of the immune system? Yes, it's B, the spleen. Right, the spleen has a lot to do with the immune system. What does the pancreas do? What does the liver do? What does the thyroid do? Do you know that answer? Do you know those answers? Trying to eliminate your options are important. Liver makes bile. Pancreas has 2 purposes, right? Produces insulin, right, and glucagon, which help with regulating your sugar levels, and also breaking down food with bicarbonates and enzymes to help with that chyme production, right, in your stomach. And your thyroid, what does it do? Regulates calcium, right, your parathyroids, and some other hormones involved. So B was your correct answer on spleen. That was question number 8. Question number 9. We're almost done. Don't leave. We might have a bonus question as normal. Question number 9. Question number 9 is a sterilization question. How often should a biological testing of ETO sterilization be conducted? That's a gas or ethylene oxide sterilization. How often should we test that for biological? Is it every load? A, every load. Is it B, weekly? Is it C, monthly? Or is it D, twice a week? What do you think? And why are we using a biological indicator anyways? And what is the biological bacteria used for that indicator? In this case, A is every load. You should use a biological indicator because it's the only or the most reliable way to prove something's been sterilized is using a biological. Now, a chemical is just proving that it's been through a process, such as tape or maybe a chemical indicator in a tray. That's not the most reliable way, only a biological. ETO over steam, there's biological bacteria that's used, such as Bacillus subtilis, and there's other bacteria involved in ETOs, right? In this case, every load, you should have a biological indicator A. Question number 10, hopefully. Another sterilization question. Which of the following is a liquid chemical sterilant often used for sterilizing endoscopes with a cycle time of 30 minutes? A, isopropyl alcohol. B, sodium chloride. B, sodium chloride. C, peracetic acid. Or D, glutaraldehyde. Now, just looking at that, a liquid chemical sterilant, sterilizing endoscopic. That's key, right? Sensitive items like scopes, right? In this case, peracetic acid is your option. There's something called Sterad or Steris systems. In this case, it's a Steris system that uses peracetic acid for sterilizing scopes or sensitive items. And typically the cycle is about 30 minutes. The other options there is that alcohol is an intermediate disinfectant, Glutaraldehyde is a high-level disinfectant, and sodium hypochlorite is typically saline, right? Not used for any kind of sterilization. Parasitic acid is your answer for C. Well, you stuck around to the end. I appreciate it. I did this really quick. Yes, I am busy, and I apologize for not having videos up for the lab. We're going to try to get some more videos in the near future. Don't forget to like and subscribe and try to share this content. It really helps me out here on the YouTube page and here at Southern Technical College about spreading the information out. If you're interested in this program, obviously you can reach out to me, reach out to the school. We'll try to give you tours. There's a lot of good things going on. I can tell you a little bit about what's going on here. We have grants available, anyone from Lee County or Charlotte County. So look into that, inquire about that. That's free money from the government that we're providing through a grant towards your education here at Southern Technical College. We're also looking for new affiliation sites. So if you have an affiliation agreement with us, we're willing to have that conversation. If you're watching these videos, give me a like and subscribe. Tell me what you think. What are you looking for? Do you like this? If you're a student here, walk in the hallway. What do you want to see? Did I give you a bonus question? I don't know if I did or not. Do you want a bonus question? So I'll give you a bonus question. If you're stuck around to the end, we're talking about neurology tomorrow in the surgical procedure class 3. So answer this question. I'm just going to verbally say and ask and see if you guys know a little bit about the anatomy, right? We're talking about the brain. Do you guys know the anatomy in the detail, right? So let's start with ventricles. Ventricles in the brain. What flows in the ventricles and what flows in it? So I'll give you an example. We have 4 ventricles. We have lateral, third, and fourth ventricles. Give you a second to think about it. What's in there? What flows? CSF, right? So cerebral spinal fluid, right? CSF flows within the lateral ventricles and the ventricles itself, right? All right, so another bonus question, see if you guys can answer that. We realize CSF is in the brain within the ventricles. What produces CSF? All right, do you know? You should know. In the ventricle, especially the lateral ventricles, it's something called the choroid plexus. It's a highly vascular area within the ventricles that produce CSF. It's like water, it flows through the ventricles, the lateral, into the third, down the fourth, goes around your subarachnoid space within your brain, and also down your spinal cord. Now, there's something called the third and fourth. And if you don't know what an aqueduct is, look it up. It's in Rome. It's where water flows from one town to the next. Right? They have these aqueducts. And now from the third and fourth, there's something called, do you guys know what that's called? Gave you a hint, gave you one of the words. It's an aqueduct. It's called the aqueducts of Sylvius, between the third and the fourth ventricle. These are all on CST, right? They'll say, what is the third, what's the term called between the third and fourth ventricle? It's where water flows through, or the CSF, It's the aqueducts of Sylvius. What produces CSF? The choroid plexus. Where does that live? Where in your ventricles? It lies within the lateral ventricles, right? All right, some bonus kind of questions, kind of a thought pattern. Again, thank you for watching. Hopefully this was about 10 minutes. It's probably sporadic here and there. I got some other videos. Watch that playlist up here. It has a lot of the CST. Just watch them back to back and try to give me your answers the best you can. And I appreciate you guys watching, and I know you're studying hard on the CST, and I'll see you when I see you. Thanks. Don't forget to subscribe. My face. Bye-bye.
Well, you clicked on CST and you got it. Well, just to give you a little idea what you clicked on, right? So, CST exam. What is the CST exam? It's a Certified Surgical Technologist exam, right? That's why you clicked on this. This type of videos, and there's a whole playlist of these types of videos about CST questions. I'm a believer in throwing question after question in front of you visualizing it and try to truly understand it. So I've kind of went over where I had 3 questions, 10 questions. Today we're going to have 5 questions. So if you stick around, we're going to go over some 5 questions that are on the CST exam, in my opinion. I do have some exams from the AST website, and I do go over some questions periodically with the class that I instruct here at Southern Technical College. But for you that stuck around and want to watch this video, it's in your interest, or it behooves you to stick around to the end to kind of see what the last question is, or see these questions in general. To give you a little lay of the land, the format, how I run this type of page, or at least this playlist of CST questions. I'll read the question to you. I'll throw it up on the screen right here in front of my face, kind of break it down, A, B, C, or D. And if you want to pause that video, answer it on your own, because I will give you the answer as soon as I'm done with that question. We're going to go through 5. I want to keep this about 10 minutes long, because otherwise I'll be here till tomorrow. And I know I haven't got a lot of videos out there. There's some lab videos. You can see how students practice in the lab. Now, just remind you, these are lab student videos. They're also for you to look at, get a sense of what lab's about. For me to see mistakes, because you'll be surprised what you can see on there. You can see what not to do sometimes. So be kind. Anyone that's been out in the field, hey man, they're not wearing glasses, they're doing this. I know, it's good advice. Just realize these are for educational purposes. Hopefully you learn something from it. You get a perspective of what the field's about, and that we actually stick together in this field. Because, yeah, it can be kind of cruel out there, right? Why are people tearing people down? Try to build people up, right? I'm not going to preach anymore. So anyways, let's start with some questions. That's why you clicked on here. I'm not going to rant. I can rant all day. Let's start with that first question. We'll put it up on the screen. Remember, pause that video if you want to think about it, because I'm going to go right into that answer, right? First question, put it up on the screen. Here we go. Which of the following is the most important consideration when cutting sutures? Is it A, avoiding the knot? Is it B, using sharp scissors? Is it C, opening the scissors wide when cutting? Or D, tagging the end of the sutures to be cut with a hemostat? So what is the most important consideration based on the surgeon or the PA that's tying these knots? You know what it is? Well, it's A, avoid those knots. I think they're all really important. These questions try to go with the most obvious answer, the most profitable answer. So, yeah, when you cut sutures, you can't cut that knot, right? You'll probably get that look, right? So, care must be taken to avoid cutting knots. The end must be short to reduce the amount of foreign material, but suture ends must be long enough so that the knot does not untie, right? When suturing, have you ever looked into suturing? It's all about getting this, not a granny knot, but a square knot, right? So you're squaring off so that it gets a good tightness on that tension, that knot itself, right? So that's the first question going on. Again, we're going to have 5 questions, but if you stick to the end, right, I will give you a call of action to go into some other good information that also helps you prepare for the CST exam. So stick around a little bit if you want. Hopefully, if you're going to go to another video, man, just go ahead. Anyways, question number 2. Put it up on the screen as I try to find it. All right, here we go. Question number 2. When performing a D&C, otherwise known as a dilation and curettage, which of the following instruments is used to grasp the cervix? As you can see, A, the Sims, B, Avard, which is a weighted speculum, Schroeder, or the Bozeman. What do you guys think? There's the thing about instruments, they're not going to use common names. They're going to use the names they were developed by maybe the surgeon. I'll give an example. The sponge stick is the Forrester, the banded scissors or the Listers, and so forth. In this case, we should know that it's a 2-prong tenaculum that we grab onto, but it's C. They call it the Schroeder. Yeah, so I don't know, not sure you knew that or not, but now you do. Schroeder is your right answer on question number 2. Let's just roll right into question number 3, okay, guys? Question number 3, put that up on the screen. Which of the following instrument is used for placement of cottonoid strips during a craniotomy? So this is if you've done neuro, right? What is a cottonoid? You should know it's a sponge, a small square radiopeg sponge they use in neuro cases. What do you pass it with? What forceps? Is it A, the bayonet? Is it B, a Russian forceps? C, a Kelly clamp? Or D, angle DeBakey clamp? Right. I think that's pretty easy. If you don't know that, you probably didn't do any neuro, right? Common theme for hemostatic thing, right? Think about it. You nick that dura. You use a little bit of bone wax on the back of a freer. Follow that up with some gel foam with thrombin on top of that. And then maybe hit it with a cottonoid on top of that. In my opinion, that is a trifecta there, if you will, of hemostatic agents. But in this case, A, bayonet forceps is something we use to pass it along either to the surgeon or up to the surgeon so they can grab it with their bayonet or their Cushion's bayonet or bipolar forceps, whatever's in their hand, really. In this case, a bayonet forceps is your right answer. Question number 4. Remember, 5 questions. If you stick around to the end, I'll give you some other good suggestions for you or maybe a bonus question. So stick around, okay? We're almost there. Question number 4, as I find it. Remember, these questions are off of a CST exam or an AST exam. No one truly knows what's on the exam, but all you really can do is grab resources. This is actually right off their webpage or their exams they provide. Yeah, I know what you're saying. They don't update those exams very much, but at least you don't have to go and pay for it. You got some questions right here. And if you stick around, I'll provide a lot of these informations, a lot of these questions from these exams. Now, if I really like you, I'll send you a link. Put your comments in there if you want a link. Here's a question I find. I believe this is question number 5. Last question. So let's rock and roll, and then we'll swing into a bonus information here. But this question here, I find a lot of people get wrong. Maybe just don't realize it. They don't do a lot of GYN. But here's the question. We'll put it up on the screen. The STAMI needle is used for which of the following types of surgeries? Is it A, hysterectomy? Is it B, prostatectomy? Is it C, bladder suspension? Or A, anterior colporaphy? So, what do you guys think? STAMI needle, right? Yeah, it's C, bladder suspension, right? So, incontinence, a lot of women become incontinent. So, this type of needle will help with that, in a sense, providing supportive on the bladder. That lower pelvic floor muscle is a little weak. So correct answer on that is C. All right, you stuck around to the end. I'm really happy that you did that. Hey, I just want to say thank you. There is a call of action. If you stick to the end, and you stuck to the end, so I'm going to provide you, if you have to the end, a secret message. Only if you stuck to the end. Put your name, or at least message me, and I will send you a link with all these exams. Okay? Now, if you if you got off this video, you're not going to have that resources. So you stuck around, and I thank you for that. Oh, by the way, we reached our pinnacle of 4,000 watch hours, which we are now monetized. And I thank you for that. You know, everything I'm trying to at least provide for the students in the sense of financial support for externships was all about this page. Resources for you guys. I know there's a lot of people out there from other countries, Iran, Pakistan. I see you out there, and I see you applying to these jobs. Just so you know that I don't know that you guys can apply, but I do see your resumes, and I do appreciate your support. So just to let you know, if you apply to become an instructor here at Southern Technical College, I appreciate it. But if you're from a foreign country, I don't know the logistics of that, even though you guys really are interested in becoming a surgical technologist, if not in the United States, definitely in your field that corresponds to what we do here in the United States. There were some questions about, can you take the CST exam if you're from a different country? The MBSTSA has if you can apply, there might be something that's equivalent to a proprietary school in the United States that's accredited by ABHAS or KHAB. I looked into that. I would advise reaching out to the MBSTSA if you are interested in taking the CST exam and you're from another country. That's my advice. I don't see why not. I just don't know too much about that. And so I advise you guys reaching out to it. All right, I'm done talking. All right, that's my advice. Hey, watch these videos over here. There is a playlist, so watch it a little bit. The call of action, watch all those. There's good videos. Again, if you put your message to me, I'll send you a link to Google class that has a lot of good information for CST and the CST exam. All right, thanks for watching, guys. I'll see you next time.
We're back. We're back with CST review. It's been a while, but I'm back. So we're going to do 5 CST questions from the 4th edition to the CST exam. Hopefully you guys have been studying hard. I see that a lot of you have been commenting on these videos, and I'm very happy for that, because any kind of money we make from these videos go right towards externships and any type of needs that they need, gas cards, etc. If you like and subscribe, it does help out and spread the information out to the masses. Again, 5 CST exam questions today. If you're new to this format, we have a whole playlist of CST exams, and you're interested in surgical technology. We have videos of lab experiences. They're lab, so don't judge them too harshly. They're learning. We're all learning, right? So check out that information. Hopefully you can look at other playlists and enjoy that. Any feedback? I know some of the information about CST exam is probably the biggest thing people watch this for, and so I'm going to try to provide more of that. But today, the 4th edition is from the AST is out, so we're going to read some questions. This is about catheters, drains, and tubes. That sounds like a pretty Netflix movie, catheters, drains, and tubes. But we'll read the question. If you're new, we'll read the question. We'll put it up so you can see it. I'll tell you what the answers are at the very end of me reading that question. So if you want to know, or at least spend some time thinking about the question, maybe you should pause it and then look it over and then play it and continue on. We'll make this about 10 minutes long because that's what YouTube wants me to do in order to get monetized. So I'm going to talk really slow. No, just joking. Give me your feedback out there. How are you enjoying these videos? Again, if you stick to the end, I'll give you a little extra link and a secret password at the very end. And just put that secret password in the comments. Don't skip to the end because you're going to miss it. Or maybe I'll put the secret password in the middle. Who knows? But it's in your interest to watch this video all the way to the end. And then just put that secret password in the comments, and I'll send you a link to other reviews, other tests, other study formats. So first question, and we'll put that up on the screen right now. Which closed wound drains device requires being connected to a bulb evacuator? Question mark. Is it A, the Stryker? Is it B, Jackson Pratt or JP? Is it C, Hemovac? Or is it D, a cigarette drain? So stop and think about it. Pause it if you want to kind of look it over. I'm going to do something different. I'm going to give you the answers at the very end of all these questions so we can kind of go through it. I would look at these questions, review it, try to surgically map it. Do you know what the drains they're talking about? All those options there. Can you break them down? What do you think the answer is? All right. We're going to move on to question number 2. I'll let you know the answer of all these at the very end, right? Question number 2, we'll put that up there so you see it. Which catheter is used for an angioplasty? Question mark. Is it the A, the Grützix? Is it B, the Robinson? Is it C, the Fogarty? Or is it D, Swan Gauze? So break that question down. Catheter, angioplasty. You probably know the answer. I'll let you know somewhere around the end. All right, we're going to put question number 3 up there. Which vein of an infant patient in a central venous catheter inserted? Which vein of an infant patient is a central venous catheter inserted? Is it A, the internal jugular? Is it B, the saphenous? Is it C, the subclavian? Or is it D, the external jugular? What do you think? Put the answer in the comments if you know. All right, I'll let you know the answer at the end. Look at that question. When I usually look at it, I try to break it down. It's an infant patient. Does that really matter? I don't know. Do some research. Are their anatomy different when they're infants? Probably, right? Moving on to question number 4. Remember, 5 questions, bringing these up here, just kind of exposing you to the CST exam. And remember, if you stick to the end, I'll give you a secret password. Just put that password in the comments and I'll send you a link. Question number 4, which of the following, put that up on the screen, which of the following is a type of non-retaining catheter? Is it A, a Foley? Is it B, a Melcott? Is it C, a Whistle? Or is it D, a Pelzer? All right, it's a catheter, non-retaining over an indwelling, right? You have a straight cath, you have non-retaining, all right? So there's a lot of different catheters kind of in those categories. What do you think it is? Foley, Melcott, a Whistle, or a Pelzer? All right, question number 5. And we're on 5 minutes and 26 minutes. So let's kind of stretch this out a little bit. So the CST exam, so you know, it's 175 questions. It's they take out 25, so it's out of 150. That is a 65% to pass, and you need a 98 to pass the exam. I tell that to students because they kind of say, wow, that's kind of low. But if you're not putting in the work, you're not going home and studying these questions on your own. Don't try to memorize these questions. Try to retain it. How do you retain information? Well, don't memorize it. No, how do you retain it, right? Trying to truly understand the question, trying to break it down. It's called surgically mapping that question is really important, right? Some of the things I did, I used to draw it on the board, little whiteboard. Try to teach someone is always a great way to retain it into your long-term memory, right? All right, question number 5 is a type of math question. We'll put that up on the screen. How many milliliters of water is necessary to inflate a 5 milliliter balloon of a Foley indwelling catheter? Is it 5, which is A? Is it B, 10? Is it C, 15? Is it D, 20? I can just hear the nurse. Don't throw away that 10 cc syringe. Yeah, well, I just told you the answer. But yes, it's about 6 minutes. So I'll let you think about that question. And eventually I'm going to give you all the answers of these questions. I'm going to give you the answers of those, right? What do you think? It was on question 1. It was B, the Jackson Pratt. I'm just going to read you right out of the CST book. Jackson Pratt is a type of active drain consistent of a drain tube and an evacuator. I call it the grenade. You probably heard that at clinicals, right? So B was your correct answer. All right, on question number 2, right? It was a Fogarty catheter. Why did I say it like that? A Fogarty catheter. I'm going to read it right out of here. Fogarty catheter is used when performing an angioplasty. Well, they went into big detail on that. Yeah, angio is typically, obviously, vessels, right? And plasty to repair, and usually for a clot or a declot or a thrombectomy, right? So C was your correct answer on 2. Question number 3, right? I'm just going to read it, right? In neonates, infants' cut-down approach to the external jugular vein is preferred during insertion under the central venous catheter, right? So D was your correct answer on that. Has a lot to do with how big the patient is, and obviously neonates are very small, right? They have a vascular system that's not developed, so a jugular or a cut down. What a cut down really means is they're actually going through the skin and trying to expose the vessel to get access to them. In this case, D, the central venous catheter, is using an external jugular vein to access that. All right, question number 4. Right, what did you guys get? C was the correct answer, right? A whistle is a type of non-retaining catheter used to obtain urine specimens or decompress the bladder, right? Why are we decompressing the bladder? We don't want to injure the bladder, right? Why do we have patients void? We don't want to have a large bladder, right? You can injure, perforate the bladder, right? Not good, right? So C was your correct answer. And obviously, question number 5 was 10, but I'll read it for you. 10 milliliters of water is necessary to inflate the Foley in an indwelling catheter. Wow, they really give you a lot of information on these rationales. We're at about 8 to 9 minutes, right? So the secret password is Southern Technical Rocks. That is a secret password. If you put those in the comments, spread this video to your friends. I'll send you a link. All right, guys. What other things can I say? Be kind to one another out there. Externships, students. Obviously, the world's kind of a ups and downs through some of the things I've seen in the news. We won't go into detail. Spread goodness. Clinicals is very stressful. If you're a preceptor out there and you see students, man, give them some time to think it through. Wow, you know students that are having trouble. And just remember, you were a student at one time. So spreading the love, spreading the idea of learning for students is important. Students have the right to be there. And I know as an employer, you probably, why do I need to teach? It's about giving back to this field is really important. Because without that, right, we don't get paid. It's not a paid internship, it's an externships, right? You know, I have a lot of students, and I was a student, so were you, dealing with preceptors that are not very inducive of teaching, right? And I understand that. But listen, students are trying, and if you just let them, they're going to make mistakes. I understand that. If someone is willing to learn, give them the benefit of the doubt. And listen, if you're having a bad day, just communicate to them. Let them know what's transpiring in this room. Maybe they need to observe. Maybe they need to back off a little bit. I'll give you a story about a student. They walked into a room, was very motivated, and wanted to try to learn. The preceptors did not say one word to him. Almost like, why are you here? Listen, if you're that sad in your life and your job, maybe you should move on, okay? I'm just going to be honest with you. Students have a right to learn, have a right to be there. Now, if the student is not doing what they need to be, they're disrespectful. That's a whole different story. I'm going to get off on that rant. Thank you. Don't forget to like and subscribe. Any donations to this page, to the thanks, would be appreciated. It goes right to the externships and their expenses and trying to help them out in that aspect. Hopefully these videos help, and I'm going to try to do a lot more. I did this video really quick. I've been really busy here at Southern Technical College, doing a lot of responsibility trying to add on to the program. But I want to try to do some more instrument videos. I haven't been teaching a lot, so I've been more of the program manager aspect of it. So I want to try to do more instrumentation. What instruments do you want to see? Trays. I have on here on this page is a major, vascular, I think I have a neuro tray. Maybe they should be updated. Just give me your advice. Thanks for sticking around. Don't forget the code word, Southern Technical Rocks. Put that in the comments. Put that in the comments, and I'll send you a link to some more resources. Don't forget, also on Amazon is a clinical guidebook that I produce. It's called Surgical Technology STC. It is for you to take notes for your surgical externships to help you keep organized through cases. So check that out. Again, you buy that book, the resources goes right back into the school and helps students out. All right? And give me your feedback. How is that book? Did anyone buy that book out there? Don't forget to leave a review. All right. I'll see you again. Take care. Hey, you clicked on this link because you want CST exams, and I heard you. We see a lot of other videos, but you're interested in CST exam review. Well, you're in the right spot. Don't forget to like and subscribe, and look at these playlists because we have all kinds of CST review, at least I do, for you guys. I've been trying to do lab videos, but today we're going to do CST exam, at least 10 questions from the 4th edition book. If you don't know what the 4th edition book is, it's right here in my hand. I just lost my page. The 4th edition is the new CST review for the CST exam. Obviously, there's a lot of resources out there, but today we're going to give you 10 questions. If you don't know the format and you're not sure about what the heck you're looking at, well, I do questions. I put it right up in your face there, bring it up on the screen. I read the question. I give you the answers give you the choices within reason. I give you a chance to pause it, and then I give you the answer, okay? This is about exposing yourself to questions. So if you want to know a little bit before I start, the CST exam consists of 175 questions. They throw out 25, so it's 150. It's 68 to pass, and that's about 98 questions you need to pass, okay? So doable, right? It's a 52% if my math is correct. But I'm going to start something new. And obviously, if you like and subscribe and check out the other playlist, or at least this playlist from the beginning, check out the beginning, you'll see all these types of questions. But I want to start something new now. I'm going to start from the 4th edition. And I'll show you a picture. I'll bring it up on the screen here. That it's broken down into categories, right? I'm just going to start with Chapter 2. And Chapter 1 really is about taking the CST exam. I'm not going to go over that with you. I'll bore you to death. You just want to see questions. Chapter 2 goes into anatomy, microbiology, pharmacology, and so forth. I'm going to start with the chapter anatomy, right? I can't read every damn question. Excuse my language. I can't read every question, but I'll choose some that I find that are most common, at least ones that are probably difficult within reason. Some easy, but I'm just going to randomly choose on occasion. So I will start with anatomy, and that's going to be on page 10. So give me a second. I will bring the question up just to remind you, and you can see the question, you read it, you give it a chance. If you want to pause it, answer it, and then obviously see the right answer at the very last second. And then I will go through 10 of those questions. Before we get to the first question, I'd like you to look on the very bottom of this video. You'll see it down there. Hopefully you see it says hype. If you push that button as many times, it hypes this video up. What that does is spurs an algorithm. It gets this video out to the masses, surgical technologist students, and helps spread the word, okay? If you can do that for me, I appreciate it. Don't forget to like right on the bottom. Let's see if we can get to about 500 likes. Dream on, Brad. Let's get a couple likes on there. Anyways, we'll bring up that first question. Remember, 10 questions. Bring it up on the screen. Pause it, and then I'm going to give you the answer. And then if you stay to the end, I'll give you a kind of a bonus question, or maybe a secret password in order to get a link to some more exams. Okay, so stay to the end. I don't want to see you kind of skip to the end, because maybe I'll give you that password somewhere in between. You don't know. Anyways, first question, I'll bring it up on the screen. What nerve is at greatest risk during a thyroidectomy? Is it A, vagus nerve? Is it B, inferior laryngeal? Is it C, cervical sympathetic chain? Is it D, recurrent laryngeal? It's D, the recurrent laryngeal. Good choice, right? Yes, the recurrent laryngeal branches off the vagus nerve, and it is something you have to be aware of when you do a thyroid. There's 4 parathyroids. The thyroid is removed, but there is a nerve that runs off the vagus nerve, and it's the recurrent laryngeal nerve. We don't want to damage that, right? All right, question number 2, bring that up on there. Let's see if I screw this one up. All right, question number 2. Which body system aids in the metastatic spread of cancer cells? Is it A, the lymphatic? Is it B, the reproductive? Is it C, the respiratory? Or D, the lymphatic? All right, pause it, give it a thought. Metastatic spread, right? That's pretty bad, right? Cancer. Yeah, pretty easy, right? A, the lymphatic system. It's the highway, the lymph system, it drains. We do not want to have cancer in that system. So A was your correct answer on that. All right, question number 3, bring it up on the screen here. What is the lining of a thoracic cavity? What is the lining of the thoracic cavity? Is it A, the peritoneum? Is it B, pleural? Is it C, the parietal? Or is it D, the pericardial? All right, so the lining of the thoracic cavity. Give it a thought, give it a minute. 1, 2, 3, all right. It's B, the pleural cavity, right? The thoracic cavity encapsulates the pleura where your lungs sit in, right? Visceral pleura, the parietal pleura is up against your ribs. And inside that is the pleural cavity. And yes, it is the negative pressure within the lungs, correct. All right, we're on 3 questions so far. Don't forget to like and subscribe. Going on to question number 4. Bring it up on the screen. The thyroid gland consists of right and left lobes. They are joined by what? A, cricoid cartilage. B, the ischium. C, the larynx. Or D, the parathyroid gland. So your thyroid has a left and right, and it's connected by something. What do you think? You could probably use process elimination. But yes, the right answer is B, the ischium, which really stands for, if you translate, is a bridge from one point to another. I guess it derives from islands, right? Yes, but B is the right answer. Question number 5. Bring that up on the screen. Question number 5. The inner layer of the artery is the, and I've said this 100 times to my class, A, the viscera, B, the adventitia, C, the intima, or the D, the media. These are all tunicas. What do you think? The inner layer, where you take plaque, arthrosclerotic material off. Yes, it's C, the intima, the tunica intima. Yes, is the inner layer. The outer layer is the externa, otherwise known as the adventitia, and the media is the muscle layer, the middle of the layers. So the correct answer was C. All right, we're rocking and rolling for question number 6. This is a pretty simplistic question. Vitamins, put it up on the screen. Vitamins A, D, E, and K are absorbed in the what? A, the stomach. B, the intestines. C, the pancreas. Or D, the liver. Yes, any anatomy class should know this, is B, the intestines. A lot of your vitamins are absorbed in your intestines. Stomach is about breaking things down. Pancreas is about insulin and bicarbonates and breaking your food down. And liver is about producing bile and clotting factor. So yeah, B was your correct answer on that. Well, question number 7, put that up on the screen. The valves between the left atrium and the left ventricle is the what? Bicuspid, tricuspid, C, the aortic semilunar, or D, the pulmonary semilunar. So the left atrium and the left ventricle. Interesting. We have the left atrium, left ventricle. Well, it's pretty easy, right? You should know it. Do you know it? It's the, yeah, you're right. It's the bicuspid, otherwise known as the mitral valve. Hey, believe it or not, you have 2 lobes on your left side. And since it's a bicuspid, which means 2, they kind of correlate together. And if you go on to the right side, between the right atrium and the right ventricle, it's the tricuspid in between there, which means 3. Tri means 3. Yep, you guessed it. How many lobes do you have on the right side? Yeah, you have 3 lobes. So sometimes you can kill 2 birds with 1 stone there, knowing the valves and how many lobes in the lungs. Well, that was a long rant on valves. But 54, but this question 7, is the bicuspid A, right? We're on question number 8. Put it on the screen. This is going to be about cranial nerves. Put it up on the screen. Cranial nerves that regulate secretions in the gastric juices in the... What cranial nerve does that, right? Now, looking at it, as you can see, the Roman numerals. Looking at your cranial nerves, is it A, 3? Is it B, 5? Is it C, 7? Or D, 10? Cranial nerve that helps with gastric secretions. Yes, it's the vagus nerve, which is cranial nerve number 10, helps with gastric secretions, right? The vagotomy will help decrease secretions. The vagus nerves helps with respiration, helps with gastric digestion, helps with secreting of your acid in your stomach. That's actually a really important nerve, the vagus nerve. But yes, that's the right answer. Hopefully you answered it right. D as in dog for vagus nerve, 10. All right, on to question number 9. God help us. Hopefully you enjoyed it. We're almost to the end. Hey, if you like, you subscribe, you hit the hype button. If you did all 3, and you promised me you did all 3, put in the comments that, hey, I pushed the hype if I can find it. and I'm a new subscriber, I will provide a link. Put that all in the comments. All right, that is your bonus information. I have a brand new link. I'm going to try to provide you an exam from this book so you can take it at your leisure and see where you are, see where you stand on the CST exam. All right, question number 9, put it up on the screen. We're going to go with a pacemaker of the heart is... So the pacemaker of the heart is A, SA node. Is it B, AV node? Is it C, the Purkinje fibers? Or D, the bundle of His? So what is another name for a pacemaker of the heart? Which you probably all know this one, right? It's A, the SA node, right? Sinoatrial node, atrial ventricle node, and the Purkinje fibers. So that is the conduction system of your heart. And the pacemaking of the heart starts in the atrium from your SA node. So the correct answer on 9 was A. All right, we're coming to the end. We could take a break. No, we're almost there. Question number 10. Let's see if you got it. Let's finish strong. The thought process takes place in the what? This is a brain question. Look at the brain on Brad. Yes, Pulp Fiction. The thought process takes place in the what? Midbrain, the cerebellum, the cerebral cortex, or the foramen of magnum. So where is your thought pattern or process take place? Yes, it's C, your cerebral cortex, right? That is where your thought pattern takes place. Process takes place from your frontal, parietal, occipital, and obviously your temporals, right? These are all your lobes, which consist of the cerebral cortex, the largest part of your brain. Looking at the cerebellar, which is your equilibrium, foramen of magnum is where your spinal, your brain stem stems down into your vertebrae, and your midbrain is exactly part of your brain stem, right? Midbrain, medulla oblongata, and your pons, right? In this case, your thought process takes place in your cerebral cortex. Well, that's 10. Hopefully you got all 10 and you enjoyed this. Yes, I'm going to try to start doing CST questions more. I think you guys want to see this. This is what I hear. I've been trying to do other stuff. I don't know if it's popular. I'm not sure if people are liking it. I might still do it, but I will do more of these videos and I will have more lab videos in the future. So check out these other videos. There's a playlist somewhere around here, probably right there. Start there. Go through all these questions, more videos just like this, and kind of check out over there. This is a new area where I'm working on. Probably something right there about teacher vlogging, right? My first person perspective of a teacher. Anyways, thank you for joining me. Hopefully you enjoyed this, and don't forget to like, and I'll see you on the next video. Bye. Most people fail the CST exam because they don't thoroughly study. Is that going to be you? Hopefully not. You joined this page or this video because we have a new thing. I'm going to do a speed round for the next 14-ish minutes. I'm going to read as many questions as I can, put them up on the screen, expose it to you. I got it right in my hand here, so bear with me as I read along. Of course, I'm going to edit it. But I'm going to jump right into these questions as fast as I can and read these questions. Just to give you the format, I'll read the question. I'll put it up on the screen. You'll see the question, get a minute to kind of go over it. But I'm going to give you that answer, so think pretty quick, or at least pause if you really want to give it a thought. But I'm going to put these questions up, read them as many as I can for the next 14 minutes, right out of the 4th edition. Here we go. Put the first question up right now. What is the lining of the thoracic cavity? Oh, that was my dog. What is the lining of the thoracic cavity? The peritoneum, the pleura, the parietal, or the pericardium? What is the lining of the thoracic cavity? Pretty easy questions. I'm just going to randomly choose them. In this case, you should know the thoracic cavity is lined with the pleural cavity, the parietal, the visceral pleural. Within there is the pleural cavity, and that's negative pressure. All right, moving on to the next question. I'm not going to give you the numbers, just going to read them on here. Here we go. The vascular fibers covering the bones. Covering of bones is the what? Endosternum, the epiphysis, the apparatus, or the periosteum. What do you think the vascular fibrous covering of the bone is? Yeah, it's D, the periosteum. Peri means around. and osteum means bone. It's pretty straightforward on that question. All right. Of course, I mispronounced one of the words. I'm going to dub it in there so you can figure it out. Which of the following is the part of the immune system, right? Hopefully that's brought up. Is it the liver, the spleen, the thyroid, or the pancreas? Which of the following is a part of the immune system? Now, you should know the spleen is part of the immune system. Liver produces bile, does a lot of other filter system. Pancreas does a lot of enzymes and sodium bicarbonates, and thyroid helps with metabolizing and hormonal production of T3, T4, but parathyroids with calcium absorption, right? So spleen is your correct answer on that question. All right, I'm just kind of read along here, make sure I understand some of these questions. All right, the inner layer of the artery. I've said this question 1,000 times. The inner layer of the artery is the viscera, the adventitia, the intima, or the media, right? The 3 layers of vessels. The inner layer is the intima, which is C. Yes, correct answer is C. Adventitia is the externa. Viscera is not really a part of it. The media is the middle layer. There's 3 layers of the vessel. So correct answer on that is C. All right, we're about 3 minutes as I go through another question. Here's another one. Which I put it up on the screen here. Which of the following vessels empties into the right atrium? This is the flow of the heart, right? Is it the pulmonary vein? Is it the aortic arch? The superior vena cava? Or the pulmonary artery? Which of the following vessels empty into the right atrium? You have to think about that. You better get a piece of pencil out if you're not sure about the flow of the heart as my brain is processing the information. The right atrium, right? Top layer, right? It's emptying into, right atrium. Empty it into what? Yeah, it's your pulmonary vein. Which of the following vessels empties into the right atrium? So that's a kind of trick question there. So just realize emptied into the right atrium, it's the largest part or the top part of your chambers. And the superior vena cava is emptying into those atriums and obviously into your ventricles and so forth. So the correct answer on that is C, your superior vena cava or cava. All right, it's going right along here. Vitamins D, A, E, K are absorbed in what? Put it up on the screen. Your stomach, your intestines, your pancreas, or your liver. Right? Where are these vitamins absorbed in? Well, hopefully you had time to think about it. It's your intestines. Your small bowel does a lot of the absorption, where your large bowel is more fecal in absorbing whatever water is left, right? So correct answer on that is your intestines. All right, moving right along. We got 5 minutes. Wow, we got a long time. I'll read a lot of questions here. Which structure articulates with the head of the femur? Put that question up. Which structure articulates with the head of the femur? Is it the ilium, the pubis, the acetabulum, or the ischium? So where is the femur? Articulates with the head of the femur. That's a fossa, right? It's the acetabulum. C is your correct answer on that, right? Know your orthopedic, your bones, your joints, where they connect, what types of joints. Corresponding to that is your shoulder, it's a glenoid cavity. Your hip is the acetabulum, right? Reading some other questions here. So here is also a joints, the types of joints, right? The sutures. The sutures of an adult skull are an example of what type of joint. Synarthrosis, psychordosis, amphiarthrosis, and diarthrosis. Why brutalize one of those names? So these are types of joints, freely movable, slightly movable, or immovable, right? In this case, the cranial sutures in your skull, especially when you're an adult, which is key, because when you're young, they're pliable, are immovable. You can't move them. In this case, it's going to be your synarthrosis is your A is your correct answer. As freely movable is like your elbow, and your vertebrae is going to be your amphiarthrosis, right? In this case, A was your correct answer on that. Next question, we'll put it up on the screen. What is the part of the brain that is responsible for controlling the body's temperature? Is it your cerebellum, your pons, your cerebrum, or what do you think? The hypothalamus. Your thalamus is right in the middle of your brain. It's kind of like the router sending signals out. Right below there is the hypothalamus. Yes, that has a lot to do with controlling temperature in your body. Thermoregulation. Look that word up. In this case, D was hypothalamus. Hypothalamus. It's hard to read these questions fast. All right, next question. Put it up on the screen. The process at which blood cells form is known as... Words I can't pronounce. Next question. Next question we'll put up on the screen. The conduction fibers that extend from the AV node to the intraventricular system from the what? So looking at the conduction system, fibers that extend from the AV node to the intraventricular system, otherwise known as the septum that runs down the middle. Is it A, SA node, bundle His, vagus bundle, or the left bundle branch? Throwing stuff out in left field here. In this case, the bundle of His is where the AV node goes to down the septum, down the Purkinje fibers. So B, bundle His, was the correct answer on that. So here's a question, pretty easy one. Put up on the screen. Primary functions of the gallbladder is to what? Store bile, produce bile, emulsify fats, metabolize fats. Well, it's kind of a trick question here. The primary function of that gallbladder is to store the bile to eventually put into your duodenum to help break down fats. In this case, the main thing for the gallbladder is to store the bile. The liver will produce the bile, right? Next question here. The small intestines attached to the posterior abdominal wall by the mesentery, the peritoneum, the falciform ligament, or the lesser omentum. The small intestines attached to the posterior abdominal wall by what? I'm going to go with the peritoneum, right? So it attaches to your peritoneum on the posterior abdominal wall. I don't know. Someone fact check me on that one. Next question. The organ that connects by a duct to the duodenum is the organ that connects by a duct to the duodenum is the pancreas, the gallbladder, the stomach, or the liver. The organ that connected by the duct to the duodenum is the pancreas. Yeah, so the pancreas is literally right there to the vater, ampulla of vater, and the hepatic duct, and everything's draining into the duodenum to help break food down. And so correct answer on that is the pancreas. Next question. What are we at here? 11 minutes, probably around 10 minutes in that range. Keep reading some questions. Hopefully you guys enjoy this. Make sure you like and subscribe. There's a lot of good resources on our YouTube page. But spread the information out there. Put your name in the comments. Oh, by the way, I posted something. If you want, I call it the CST Bible. Right? I've broken everything down, question-wise, specialty-wise, based on the AST format in the CST exam or the MBS TSA exam, structure-wise. All the information you need based on subjects and categories. If you want that information, well, it's not free. But what I can do is if you go in this page and go to the thank button on the bottom and donate something, $2 minimum, $3, $10 I'm looking for. If you do that and I see that you donated, and if I try to get your email, I will send the document to you with a lot of other links of other exams just to show my appreciation, okay? Hopefully you guys can do that. Really, all this money's not going to me. I'm not trying to retire off it. I'm trying to gather funds for the students for externships, gas money, and so forth. If you saw what I make on this page, you would laugh. It's enough to buy a dinner, okay? And some cards here and there. So I'd like to try to get that out there more. I appreciate it. Next question, random question. We're at 12 minutes. Stop talking, Brad. Read the question. That's all we want to know. Here, it's a cell question or neuron question. Which part of the question? Put the question up. Which part of the neuron conducts impulses away from the cell body? Is it the axon, the dendrites, the soma, or the ganglion? So which part of the neuron conducts impulses away from the cell body? Going away. It's afferent, it's efferent, not afferent. So away from the body. You have to know the cell, right? The soma, the dendrites, the axon. Which way is the signal going towards and along which pathway? So they're asking away. In this case, we're going to go away on the axons. We're going to go towards on the dendrites. So A was your correct answer on that question. All right. Trying to find one. Here's a question about the skull. In which fossa, I'll put it up on the screen, which fossa is the cerebellum located? So which fossa is a little area where things sit. So which area or which fossa is the cerebellum located? The medial, the lateral, posterior, or anterior of the skull? Anterior, posterior, lateral, medial, up top somewhere. No, we know posteriorly, the occipital area is where the cerebellum, which is your hindbrain, where a lot of your equilibrium and balance is located, right? Trying to find a hard one. We're coming up on 14 minutes, probably 13 minutes. I'll go with 2 more questions, and hopefully you guys can stick to the end here, and I'll give you my thoughts here. Here's one. Bring it up on the screen here. The heel bone of the foot is called the tarsal, the phalanges, the calcaneus, or the metatarsals. The heel. It's also the largest part of your ankle bones, right? Yes, it's C. You guys probably knew this. Or any ortho guys, they knew it, right? The calcaneus is your largest of your bones, is also your heel bone, right? The navicular, the talus, the cuboidal, these are all bones in your ankle. This one is the largest of your foot bones. Trying to find one more question. I'll end it with an orthopedic question. Another name for a spongy bone. Is it the callus, the calcaneus, cortical, or compact? Which is another name for a spongy bone? Well, it's B, the calcaneus bone. Well, cortical is going to be your hard bone. Compact, probably very similar. Callus, these are all terms used in orthopedics. The 2 bones, the types, hard and soft, are going to be cortical and cancellous. In this case, B is your correct answer. Cancellous is your spongy type of bone. They also correspond to the screws, right? The ortho guys, right? Cortical, cancellous, those are types of screws. It's also pedicle screws, types of screws you use in orthopedic for putting plates on, right? Anyways, 16 minutes. I'm not sure how far I got. This was a speed rush of questions. I'm glad you joined me. Don't forget, if you're interested in the $10 CST Bible that I produced, put into the thanks, donate what you can. That's the only way you're going to get it. I put a lot of time and effort into it. I give it to my students for free at school. Well, they're at school, they pay tuition. So if you guys want to have access to that, donate what you can. Otherwise, check out these other videos, subscribe, share, and hopefully you enjoy this process of a speed CST questions, and I'll see you on the next video.
Yeah, you're back. CST exams. Well, welcome back. We're going to go over 10 questions. Going to get right to it. Give you the format. Again, just so in case you don't know, I'll read questions from the 4th edition, which is the AST manual that they provide for students to prepare for the CST exam. But I'm going to go over 10 questions for you today, going over through the chapters. Today is pharmacology types of questions. So I'll read the question to you, kind of bring the question up in front of you there. We'll read it together. You can see the options. If you want to pause it, because I'm going to let you know the answer right away. Maybe I'll give you a little rationale. I'm going to try to keep this video about 14-15 minutes long. So stay with me, stay a part of it, and don't forget to like and subscribe, because that helps me out with the algorithm and getting this video out there that anyone wants to see these resources. There's a lot of resources out there, but you chose to stick with me. So I thank you for that. Yeah, so CST questions. Let's just jump right into it. We'll put that first question up in front of me. And this is a pharmacology edition, so hopefully you enjoyed that a little bit. Add some comments down below and see what types of questions you're looking for. I'm just going to go with the 4th exam or the 4th edition and kind of go through the book within reason. There's a lot of questions here. I can't tell you all of them. The whole idea is just to expose you to types of CST questions. Make sure that you're surgically mapping these questions. That's really important to break these questions down. Exposing yourself is the key. Bring up that first question real quick. And here it is, right? Which sense is the last to be experienced by a patient during a general anesthesia induction? Is it A, touch? Is it B, taste? Is it C, hearing? Or is it D, smell? Right? We've all heard of that before. If you've not heard of it before, the last thing to go when patients are under induction or under anesthesia is, yeah, you know it. C, your hearing. So always be careful what you're saying out there, because patients could still hear you even though they're slowly being put under anesthesia. It's a common mistake. Yeah, we all want to say everything that comes to our mind when we think the patient's asleep. Don't do that, right? Next question, put it up on the screen right now, right? Which medication is contraindicated for a patient with a history of malignant hypothermia? Okay, so this is an anesthesia question. Is it A, succinylcholine? Is it B, dantrolene? Is it C, palvarine? Or is it D, vecurine? What do you think? What is contraindicated? Do you know what contraindicated means? Bradley, I'm talking to you. Yeah, you know. You probably heard this question before. If not, it's succinylcholine. That is a trigger. What is succinylcholine? It's an anesthesia paralytic. It's a muscle relaxant. And so that is something that you do not want to give someone that has a history of malignant hypothermia, because that is the trigger for malignant hypothermia, right? Looking at the other options on there, dantrolene, palvarine, the other ones, right? So probably good for you to kind of understand all of those. Like dantrolene would be the opposite. That'll be a reversal or help to treat succinylcholine, right? We stop the succinylcholine and then we administer dantrolene to help reverse that, right? All right, that's question number 2. We're moving on to question number 3. Put it up on that screen real quick for me. What perioperative drug is given to prevent deep vein thrombosis in a bariatric patient? Is it A, nitroglycerin? Is it B, heparin? Is it C, mannitol? Or is it D, vitamin K? So think that through before I tell you the answer. Prevent deep vein thrombosis. Do you know what that is? Bariatric. Obviously, that's someone that is obviously a little bit larger than normal. And the correct answer is heparin, right? So obviously someone that's going to be given a drug to prevent that is heparin. What is heparin? It's an anticoagulant. It's going to help thin the blood a little bit. It's going to prevent those clots from forming in your calves, right? And thus the deep vein thrombosis. Thrombosis, what that means, that thrombosis or a thrombus, it's a stationary clot, right? We don't want to become an embolus, right, and go to your lungs. So given this types of medication will help reduce or prevent that from occurring. So correct answer on that was B, heparin, right? Hopefully you got it. Let me see if I can remember what question I'm on. All right, question number 4, put it up on the screen. Question number 4, put that up on the screen. I know how to read it now. Put it up on the screen right now. Which of the following specialties would involve the use of inducing hypothermia? All right, so which of the following specialties would involve the use of inducing hypothermia? So it's very low temperature. Is it A, orthopedics, B, GYN cases, C, cardiothoracic, or D, pediatrics? So what do you think? I mean, obviously you're inducing hypothermia, and why, you think? What do you think? Yeah, correct answer is C, cardiothoracic. They do a lot of reducing the temperature of patients to help minimize damage to the actual tissue. My father had a procedure done. It's a thoracic aneurysm, and they put them on ice. They like to say that, right? But they induced hypothermia to help reduce damage. They do it in open hearts too. They'll help slow down or at least stop the heart with something called a cardioplegia solution, which is cold potassium, and they'll cool down the heart with that pulmonary bypass system. So yes, cardiothoracic is something that's normally used in hypothermia or cryo kind of surgery, right? All right, question number 5, moving right along. Don't forget to like and subscribe. I really appreciate your support out there, guys. If you didn't notice, I have a new camera, so I'm trying it out. Hopefully I look better. I look very pale, but don't we all? It's cold. Question number 5, here we go, put it up on the screen. What block involves medications being injected into the subarachnoid space? Is it A, regional? Is it B, spinal? Is it C, nerve? Or is it D, your bear or bear block? What do you think? What is the subarachnoid space? Can you break that word down? Sub is below, arachnoid. Yeah, that's the meninges. You have the dura, you have the arachnoid, and you have the pia mater. In this case, the subarachnoid space, right? That's where your CSF flows. So when you're doing a spinal, they're injected in your CSF. They're injected in lidocaine within your CSF. So that can help with loss of sensation for your lower extremities. And it's usually around L2, L3. It's called the horse's tail or the quada aquata. And that's something that they'll want to get into the subarachnoid space. Don't confuse spinal and the epidurals, because those are a little bit different. They go in the top part of the dural layers. This is going right in the subarachnoid space. So spinal is typically used in that sense. So other options on there were regional, nerve. Now regional is kind of obviously in the region, like a local, right? Nerve block, again, I think nerve and a bear block is very similar, right? You're accessing the nerve block right into the nerve with a two-cuff system, and they call it a block, right? Anyways, that was question number 5, and that correct answer was a spinal is injected in the subarachnoid space. Going on to question number 6, moving right along, about 8 minutes. All right, question number 6. Cefazoline, otherwise known as Ancept, is what? What type of drug is that? Is it a diuretic? A, diuretic. Is it B, a steroid? Is it C, a mydriatic? Or D, antibiotic? I think you guys know this one. Yeah, it is an antibiotic. Obviously, we have trade in general. You probably hear Ancept a lot of the time. Did the patient get Ancept? But yeah, it is an antibiotic. Do you know what an antibiotic is used for? That's probably what I would study. What about the other one, the diuretic? That's something to help with controlling fluid, like mannitol, right? Or Lasix. Steroid is an anti-inflammatory, and a mydriatic is obviously used for constriction. Eye drops come to mind. But your correct answer on this, it's antibiotic. That was question number 5. We're going on question number 6, so bring that up on the screen if I did not say that already. Question number 6. Which medication can be used as a topical jelly during a cysto case or cysto procedure, a cystoscopy, a cystoscope? Is it B, bupivacaine? Is it A, bupivacaine? Is it B, xylocaine? Is it C, sensorcaine? Or D, procaine? So what do you think? Do a lot of cysto cases, they typically want to use lidocaine or xylocaine in that aspect for pain control. And that's usually because they're going up the urethra. It's going to reduce pain post-operatively, right? So topical jelly during cysto cases are used is usually xylocaine is your correct answer on that. Question number 7. We'll put that up on the screen. We're going to keep moving right along. Intraoperatively, lidocaine and epinephrine may be contraindicated in patients who A, are immune compromised, B, hypertensive, C, are dehydrated, or D, a diabetic. So given patients intraoperatively, that's during surgery, that have lidocaine and epinephrine may be contraindicated with patients with what? Probably something that you should not do, is what they're asking. What do you think? The correct answer is hypertensive. So lidocaine and epinephrine is going to increase your blood pressure. And that would be something you don't want to do. They're already hypertensive, right? So you do not want to give those items or those types of drugs to anyone that's hypertensive. So it is contraindicated, right? Moving on to question number 8. Hopefully you're enjoying these videos. I try to provide you guys with just kind of resources, at least exposing you to some of these questions. I know you guys are watching other videos, and I really encourage you to do that. And I appreciate you guys watching this video. Again, if you like, down below, you hype this video. I try to provide you links in the comments. If you just put your name in there hey, I'd like to hear from you. What is your journey? Are you just starting? Or are you someone that's out in the field and you're watching this video and you're like, what the heck this guy's talking about? Hey, just tell me. Tell me where you're from. Introduce yourself. Give an example. I'm Brad. I'm from Port Charlotte. I'm an instructor and I teach surgical technology. And I thank you for watching. So go ahead and put that in the comments. It really helps me. It spurs the algorithm a little bit, okay? We're going on to question number 9. And put that up on the screen right now, okay? Here it is. What is the major side effect of thrombolytics? Okay? Is it an infection? A, infection. Is it B, hemorrhage? Is it C, nausea, like I am now? Or is it D, clotting? So what is the major side effects of thrombolytics? So when you break that question down, you look at that question, do you know what the heck thrombolytics are used for? I did, and I do. No, I do. Thrombolytics are used for breaking up clots. So if I had a stroke, they'll give me thrombolytics to help break that clot up. But unfortunately, the side effect of that is that you could hemorrhage. You could bleed a lot. So the correct answer on that is B, hemorrhaging, right? All right, we're coming to the end. Hopefully you stuck to the end. I will put a link in there if you just, like I said before, introduce yourself, tell me where you're from, tell me how you're liking these videos, tell me something, okay? Question number 10, are you ready? Brad, are you ready? Yeah, put it up on the screen, I'm ready. What medication is given to treat malignant hypothermia? We're going to finish easy, evidently. What medication is given to treat malignant hypothermia? Question mark. Is it A, epinephrine? Is it B, dantrolene? Is it C, corticosteroid steroids? Or is it D, not atropine, it's atropine sulfate? So what do you think they use to treat malignant hypothermia? I told you on the other question, yeah, you're right, it's dantrolene. Succinylcholine is a trigger, dantrolene is a treatment, and those are two things you should know, if anything, out of pharmacology. It's a very common question you'll hear from your program, definitely on the CST exam. Was that 10 questions, Bradley? Yes. I don't know how well that was. But anyways, thank you for watching. Do not log off right now. If you want to hear a little bit of my discussion about other things, look at other videos. If you want to look at other videos that consist of this playlist and other CST exams, kind of look off to the right or left. You'll see a box. Click on it. If you're interested in surgical technologists, check out the lab videos. And I appreciate you guys watching. Hopefully I look great on this new camera. We'll see, because I haven't seen the footage. Anyways, thank you for joining me. I'm going to try to get other videos and keep doing it in this playlist. So I will see you next time. Thanks.